Good afternoon and welcome everyone to the joint meeting on the Senate Committee on Health and Human Services and the Assembly Committee on Health and Human Services. I am Chair Fabian Dañate and I will be chairing the meeting today. Madam Secretary, please proceed to call the roll.
Senator Lang? Here. Senator Stone? Here. Senator Taylor? Present. Senator Titus? Assembly members Dahlia? Here. Edgeworth? Present. Gonzalez? Here. Goulding? Here. Gray? Here. Hafen? Hibbets? Here. Hunt? Here. Jackson? Here. Koenig? Here. Nadim? Wynn? Here. Orant Liquor? Here. Chair Brown May? Here. Chair Dañate?
And I'm present. And please mark Senator Titus and Assemblyman Hafen present when they arrive. Good afternoon, everyone, and thank you so much for joining us here today. Today, we do have two bill hearings on Senate Bill 494 and 495. We will be starting today with Senate Bill 495, but I want to go over just a few housekeeping items for those who are here to participate. Please note, as I mentioned, we are going to take the agenda items out of order as what's listed on the agenda. For those that wish to testify today, we ask that you can please sign in at the door and provide a business card to the committee secretary. If you do not wish to testify, you may still want to sign in so that there's a record of who is interested in a particular bill, and in the event the committee needs to contact you later. When testifying, please turn the microphones on to speak and off to listen, and we have listeners and viewers in Las Vegas and online as we are recording this meeting. We ask that public comments be kept to 2 minutes so that everyone interested in speaking can be accommodated and we can get through the agenda in a timely fashion. And of course, as always, speakers are urged to avoid repetition of comments made by the previous speakers. And last but not least, we ask for folks to please turn off their electronic devices, especially their cell phones, or put them on silent mode during the meeting. With that, we'll go ahead and start with our first bill, Senate Bill 495. This bill revises provisions relating to healthcare. I will go ahead and open the hearing on this bill and invite our governor to begin his presentation.
Sorry I was a little late walking over. I guess our timing got a little convoluted, but with that, good afternoon to everyone. Good afternoon, Senate Chair Dañate and Assembly Chair Brown May. I said it right? And joint members of both the Senate and Assembly Committee on Health and Human Services, thank you for the opportunity to present today. I'm here to introduce the Nevada Healthcare Access Act, also known as Senate Bill 495. Adequate and timely access to health care remains a pressing challenge for many Nevadans, including myself and my family. Just last year, my young grandson was hospitalized for a serious ear infection. He needed emergency surgery, where there wasn't a doctor at any hospital in Southern Nevada who was equipped to perform the procedure he needed. Mercifully, by chance, there was a visiting surgeon from Texas in town who was able to treat my grandson and help me get him on the road to recovery. The reason I tell this story is Nevadans seeking medical care face long wait times and have trouble accessing specialists. The need for more doctors, nurses, specialists, and healthcare providers is increasingly evident. Nevada Healthcare Access Act is legislation designed to address this very issue. This legislation will help grow our healthcare workforce while also expanding mental health resources and streamlining healthcare services across Nevada. The Nevada Healthcare Access Act seeks to build and support our healthcare workforce in several key ways. First, the Act accelerates the state's licensing and credentialing processes for healthcare providers. Getting doctors into Nevada facilities and caring for patients much faster. This bill also directs the Patient Protection Commission to complete a comprehensive study to assess I'm sorry, it's the afternoon. I had a few drinks. I'm joking. – Is the Nevada Independent here? I'm joking. This bill also directs the Patient Protection Commission to complete a comprehensive study to assess the development of an academic medical center in Nevada, which will further help the state grow its future healthcare workforce. In addition to these efforts, my office has worked with Senate Bazina to incorporate my proposal to increase graduate medical education residency programs into her legislation, which will help us attract top talent and address critical provider shortages in underserved areas. The amendment reflecting this change has been submitted to the committee. The act expands access to mental health resources and creates the Office of Mental Health, which would oversee mental health services across Nevada. The act also expands funding for community-based mental health services, which will provide critical support for individuals with severe mental issues. The Nevada Healthcare Access Act also aims to streamline healthcare services across the state. This streamlined vision includes the creation of the Nevada Health Authority, a coordinated statewide approach to healthcare delivery. And according to the chair's comments a few minutes ago, you will hear about that here in short order. The bill also reduces administrative barriers to care by standardizing prior authorization processes and timelines while ensuring prompt provider reimbursement. And lastly, the bill enhances Nevada's presumptive eligibility framework by introducing streamlined application processes and vendor-supported systems to improve Medicaid enrollment for eligible individuals. By bolstering and growing our healthcare workforce, expanding mental health resources, and streamlining healthcare services across the state, we're going to build a more robust, accessible, and sustainable healthcare system for all Nevadans. With that, I'll ask Director Whitley and Administrator Weeks to come forward to present the bill in greater detail. And I want to thank the committee again for the opportunity to present to you today. I'm hopeful we can make meaningful progress in expanding health care across the state together. So thank you very much. And at this point, I'll take my leave unless you have any questions for me.
Governor, please forgive me. You forgot to state your name for the record.
For the record, Governor Joe Lombardo, the great state of Nevada.
Thank you so much, Stern. Thank you so much for joining us today.
How come you did that and Fabian didn't do that?
Governor, in this committee, he's Senator Danyate.
We show grace in the Senate.
Thank you. Let's go ahead and proceed with the presentation, please.
Thank you, Chair Donate and Chair Brown-May. For the record, Richard Whitley. I serve as the Director for the Department of Health and Human Services, and with me is Stacy Weeks, who serves as the Administrator for the Division of Healthcare, Finance, and Policy. And so, if you've read this bill, it's the topics, although pretty concise, are spread throughout a number of pages. And so what I planned on doing was going through the topics, referencing the sections that you'll find referenced in the bill. So the Governor's Healthcare Access Act, it covers multiple topics, and so I'll just start that with the amendments that the Governor made reference to. As posted in Nellis, there is an amendment from the Office of the Governor removing the section of the bill creating the Nevada Health Workforce and Access Program and sections related to graduate medical education. Section 7 related to healthcare workforce and access and will be retained since this is a biennial assessment of the healthcare workforce needs in our state and is used to accomplish other goals in this legislation. Nevada Healthcare Workforce and Access Fund Program. Sections 2 through 6 in the bill and sections 8 through 18 are removed in the amendment. What remains is the establishment of the Healthcare Workforce and Access Grant Program, which is a competitive grant program managed by the Department of Health and Human Services to address critical shortages and providers of healthcare in the state. Additionally, sections 34 through 40 and 4 through 9 are removed in the amendment. Moving on to the topics that remain, expedited hospital credentialing found in sections 19 through 27, section 50, section 74 through 76, 84 through 86, 117 through 118, 20, 43, 47, 50, 75, 85, 109, and 113. I think where you find these statutes also are reflective of the process and the problem we're trying to address with this, and that is the time it takes to get credentialed from the time of licensure to credentialing with a health plan to being onboarded at a hospital. And so the bill is intended to actually make that process easier, making use of data that is already being collected in one place and can be used in another. Our first topic, again, found in many sections. The next is prior authorization and payment reforms, and they can be found in sections 22, 44, 47, 53 through 62, 69, 72, 97 to 108, and 110. And this proposes to reduce administrative barriers to care by standardizing prior authorization processes and timelines while ensuring prompt provider reimbursement. These reforms enable the healthcare professionals to focus more on patient care and perhaps less on administrative burdens and delays. Next is paramedics enhancing the workforce in a hospital setting, and that can be found in sections 29 through 31. This expands the scope to support patient care in a hospital setting, particularly in rural areas of the state. The State Board of Health is tasked with adopting regulations authorizing paramedics to be employed or volunteers in a hospital setting. Next is dental workforce development found in sections 32, 77 through 82, 87 through 88. This aims to address the crisis of shortages and longer-term workforce strategies, by increasing access to dental care, by expanding training programs for dental hygienists and assistants. Focused on underserved areas, the initiative aims to address the gaps in service. Next, we have presumptive eligibility. This is found in section 51. It enhances Nevada's presumptive eligibility framework by introducing streamlined application processes and vendor-supported systems to improve Medicaid enrollment for eligible individuals. Next is the Office of Mental Health, found in section 67 and 89. The goal of the Mental Health Office is to expand access to behavioral health services and ensure better coordination of care, aligning it with the payer, the largest payer of mental health care. Next is the Academic Medical Center feasibility study found in section 120 through 121. This funds a study through the Patient Protection Commission to access the development and enhancement of academic medical centers in Nevada. And that concludes the high-level overview. I could read the whole bill, but we stand ready to answer questions.
Thank you so much. I'm going to just do a quick round of questions just for clarity's perspective, and then, of course, we have members that have questions. So just to be clear, the amendments that you referenced, we are deleting the portions relating to GME, as was referenced earlier, along with Section 119 of the bill. Is that correct?
Yes,
That was
for
the
the record,
appropriation.
Richard Whitley. Yes.
Thank you. And then the earlier sections that deal with the healthcare workforce account and so forth, those are also the provisions that have been deleted.
For the record, Richard Whitley, yes, the ones I referenced.
Thank you. And then just one last question. I know section, towards the end of the bill, it's the recommendations of the study that's developed by the Patient Protection Commission. It was my understanding that the earlier sections of the bill reference to what the healthcare workforce account was going to be dealing with, and so those provisions remain unchanged to date, correct?
For the record, Richard Whitley, that is correct.
Thank you so much. Committee members, any questions? Let's start with Assemblymember Hunt.
Thank you, Chair. What an awesome presentation. My question is, what are the anticipated short-term versus long-term impacts of the bill on healthcare access in the rurals?
For the record, Richard Whitley, I'll start. I think, when it comes to healthcare, it's important to look at like the crisis at hand with shortages and a lack of access, and then longer-term strategies. I think you see that in a couple of the topics here. I think you see it on the paramedics in hospitals, and also on the dental side, where there are really that we're in a crisis situation with workforce shortages. People have coverage, perhaps insurance, but not access to the actual health care. And so that is a crisis. So sort of two-phase, short-term and long-term.
Thank you.
Thank you so much. Next, we have a question from Assemblywoman Gonzalez.
Thank you so much, Chair, and thank you so much for the presentation. I have been getting a number of messages from constituents that work specifically in dentist hygienist field about concerns about the alternative training pathway. And so I was just wondering if you could put what oversight exists in this provision to ensure that the alternative training programs meet the standards of care, and why was this pathway proposed instead of expanding existing accredited programs? Thank you.
For the record, Richard Whitley, I'll start, and then I may need to phone a friend. We have dental experts who participated, as well as the dental board. But I think, first and foremost, the authority remains intact of the dental board overseeing dentists and dental hygienists, and so nothing changed in that. I do think it gets at like the crisis that we are experiencing in rural Nevada with access to dental services, and perhaps, not always reflected very well in a bill that we propose. We don't capture other programs that we do, but you may know that with the tobacco settlement funds that Nevada receives, oral health is a component of that. And one of the areas that we've looked at implementing for a longer-term strategy is workforce pipeline scholarships, dental assistant to dental hygienist. So it isn't a long-term strategy. It is a short-term strategy to respond to the crisis of shortages. Again, for the protection of patients, this would be overseen by the dental board.
May I have a follow-up, Chair, please? Thank you. So the alternative pathway and the training, you said they would still have to go through the dental board and meet those criteria before seeing patients?
For the record, Richard Whitley, the dentist who would oversee the dental, dental hygienist, and then I just lost the term, the dental, the sub under the hygienist. Dental assistant. They work under the authority of the dentist.
Assemblywoman, does that answer your question? Thank you. Let's go to Assemblywoman Nadeem.
Thank you so much, Chair, and thank you for the presentation. My question is, what are the new standards for prior authorization and how it will help the providers and the patient?
This is Stacy Weeks for the record, Nevada Medicaid Administrator. So in the bill, well, current law right now, there is a limit of 20 days to respond to a claim, a prior authorization request for payment and authorization for service. This would align with some of the more national best practices that we're seeing, which is closer to 2 business days. We are already moving in this direction with streamlining some of our prior authorizations in Medicaid, and I think the private market as well is kind of moving in that direction. But it really does expedite that process for providers and gives them more ability to know when they can get denied and when they're not going to be denied. There's some standard practices around that in the bill.
Thank you so much. Next, we have Assemblyman Jackson, please.
Thank you, Chair. Thank you for the presentation. Does SB 495 collaborate with Nevada's system of higher education to expand health-related degree programs?
Chair, committee member Stacy Weeks for the record, Nevada Medicaid Administrator. So in the original bill, there was provisions in there to ensure that when setting up the Healthcare Access Fund, which is now, there's a separate bill, Senator Cannizzaro has a bill similar to that, there was coordination and will be coordination with the higher education system when setting up those programs. It's just it's being moved out of this bill into Senator Cannizzaro's bill. There's a similar language in those bills.
Thank you. Any other questions? Senator Lang.
Thank you. I know that you said that you've taken the GME out of this bill and you're going to incorporate with Senator Bazina's. I'm just wondering if, because in this bill the governor had slots for GME, are you increasing the slots that will go into Senator Bazina's bill?
Chair, committee member Stacy Weeks, the record. As approved, the governor's budget maintains the current funding for infrastructure costs, but does have new funding for workforce provider payments through Medicaid and increases access to GME through that avenue. But this is not designed to increase slots necessarily. I do understand that Pazina's bill does increase the funding for infrastructure costs that would support more slots in the state.
Thank you. Any other questions? Chair Brahmane.
Thank you, Chair. Thank you so much for the presentation. Thanks for being here today. My questions are really relative to around Section 67, which proposes to create the Office of Mental Health, and I know that we have had lots of conversations. Can you talk through how do we anticipate including children into this new office? And then are there clear performance indicators and how we will be able to measure success?
For the record, Richard Whitley. So I think if you looked at the experience of a person, it would suggest an integrated approach because like first episode psychosis doesn't necessarily occur until early adulthood. And so I think that by focusing on just one element or one age group for behavioral health, we're missing the entire system. That is in no way to say the intent is not to have a focus on children. I think we learned that both Administrator Weeks and I through over a year's work with the Department of Justice resolving some of the findings they had in the inadequacy of Nevada's system of care. It doesn't stop when a child or an adolescent ages out. It certainly doesn't stop for the families. I do think that there is a strong case to be made to have a Office of Behavioral Health. Under it, we should also have a focus on the aging population. When all the challenges collide between dementia, substance abuse, lifelong serious emotional disturbance, like are we equipped to manage that? And so looking at the entire lifespan is important within pulling out those sections that pertain to youth and adolescence. When it comes to measurement, I think the framework is, again, one that we will be monitored by the Department of Justice and also self-monitoring. And that is, as you know, the intent is to have people living in the least restrictive environment possible, which means in a community, in a home setting. And so having community-based services, certainly measurable, when those fail, is the first point of contact, the emergency room or a higher level of care. And then on the back end, the discharging. All hospitals are to do a safe and appropriate discharge. What are the outcomes of people being discharged from facilities? So the measurements are, I think, pretty specific in terms of what we will be looking at to measure. And I think the overlay of the Department of Justice has actually external people looking at us too in terms of those performance indicators.
Thank you. Any other questions? Senator Titus.
Thank you, Mr. Chair, and thank you both for being here. And really, it's a big lift, but much needed, and I think it will bring some solutions to our state. I have a specific question looking at the bill and what the intent was, and I don't know if it was amended out, but if you have a copy of the actual bill, it's on page 89. Section 85 and 86. And so when looking at this component, I've just needed an understanding about what the intent was when it says the authority may delegate to another state or local government agency responsibility for making determinations concerning eligibility. And so how does that look? What was the intent of that language? No, it's a...
Chair, Committee Member Stacy
Well,
Weeks.
I
the
guess
other
that's...
bill. Yeah.
Yeah.
Sorry.
I guess that's not even in your bill we're talking about, so. So you can answer that next time.
Is that which version of it? We're doing 195 first. Okay.
Thank you. Any other questions? I'm going to do a few if that's okay. So I want to start off first, just more commentary. Obviously, I think when it comes to healthcare, I think it's an issue that affects all of us, and it's noble to take on actions that will improve the system. I think everyone can agree with it. I think the issues before us, of course, are more in terms of what we approve and obviously what takes place, because whatever we do consider in this bill could potentially have a seismic shift in terms of how healthcare is ran in this state. I want to start first by talking about the prior auth sections of the bill. It's my understanding that, there's this narrative in this legislative session and obviously in past legislative sessions, not just in this state and across the country, of folks that have attested that prior auth is one of the symptoms of higher administrative loads towards physicians. And I think we ultimately sometimes forget the importance of prior auth, right? Prior auth exists for a reason, and it's to stop the misuse, abuse of our healthcare system, along with the duplication of services that sometimes physicians may not recognize, but the provider does. And so I guess the first question I have is, for the provisions dealing with the gold card exemption, how many states have implemented such program?
Chair, Committee Member Stacy Weeks, for the record, I think there are several health plans out there that use the gold carding method with their providers. In terms of states that I think in the terms of the Medicaid space that I'm aware of, there is one. Texas did lift this and implemented some sort of gold carding. It's a similar process to try to reward those good actors in our system while still ensuring that we have a process for prior authorization for that check that you're talking about.
Thank you. And then just to clarify, the provisions of the bill right now are looking at setting up the credentialing, streamlining, and the prior auth streamlining for all health plans in the state. Is that correct?
Chair, committee member Stacy Weeks for the record, Nevada Medicaid, yes, but we do not oversee Medicare in the state and we do not oversee ERISA plans. So you have to be mindful of the federal pieces there. So this applies to the rest of the market.
Thank you. And so just to double check, so I think this is the difficulty, right? I think ultimately, whether it's credentialing or it's prior auth, traditionally it's to the payer standards because of the patient mix that they have or the population that they're serving. And so by adopting the language that you have right now, it would essentially preempt the payers from being stricter with their prior auths or with their credentialing in terms of how they onboard providers or what they're approving, because now we have to all adhere to the same standards as what's in the bill. Is that a fair assessment?
Chair, committee member Stacy Weeks for the record, yes, it is correct.
Thank you. So going on along the lines, how do we ensure that providers do not take advantage of the gold card exemption, or what are the clawback mechanisms for when they receive it and essentially prevent the abuse that we've seen already in the healthcare system?
Chair, committee member Stacy Weeks, the record, Nevada Medicaid. I think you guys have heard me many times talk about fraud, waste, and abuse and how important I do think prior authorizations are. I think this bill does a nice job of striking a balance there and ensuring providers that are good actors can be rewarded for that good action and having good program integrity. One of the things I think we would want to work with the Division of Insurance and the Commissioner on in implementing the regulations around gold carding is ensuring that we have regular checks in the system still on those 95% providers, as well as our health plans. We want to make sure there's no, unfortunate or unintended incentive to make sure that providers don't hit the 95%. So I think it could go both ways, but this is something we would like to work through with regulations and the public stakeholder process.
Thank you. And just moving along that same point, I think there has been reference to NCQA standards and so forth in the bill, and so I want to dive a little bit deeper. It's my understanding, so Medicare is a good way for us to look at, right? Providers right now obviously have to adhere to certain standards when we are tackling issues with patients. And so we have, some payers have gold stars, right? So the better you perform to closing the gaps of the patients, the higher you are rated for quality when we're talking about HEDIS measures and so forth. And so is that something that we're going to be looking at as well for the gold card exemption? Are we also going to be looking at the quality that folks are doing, or is it just specific claims based?
Chair, committee member Stacy Weeks for the record. This bill primarily focuses on payment. And so compliance with payment policies that are in place and ensuring that there's program integrity around the way they're submitting their claims, that claims are not fraudulent, right? That they actually are medically necessary. The point about quality is well taken. It's something in Medicaid that we're actually looking at as a way to ensure that we're recognizing and rewarding those quality providers, but that is not in this bill today.
Thank you. And just to clarify, it is my understanding that other states have implemented quality as part of the metrics that they monitor for providers, sort of a value-based care program. So just confirming that that is the case.
Chair, committee member Stacy Weeks for the record. For Medicaid, yes, that is the case.
Thank you. And then just going on to the questions, I think the Assemblywoman Gonzalez kind of hinted at this. So we've been receiving, just for full transparency, a lot of heartburn on the sections dealing with dental hygienists. And so I want to make sure that we are clear in terms of the expectations if such program were to go forward. So what is a current training program right now to become a dental hygienist in this state?
Chair, for the record, Richard Whitley, I would actually like to call up in Las Vegas Dr. Sachs and Dr. Higginbotham from the dental board.
Director A.L. Higginbotham for the Board of Dental Examiners. Could the committee member repeat the question, please?
Thank you. My question was in regards to, well, let's start off on the same foot, right? What is the current requirements right now to become a dental hygienist in this state?
The requirements would be completion of a undergraduate program that is CODA approved and a completion of an exam and upon that, submitted an application requirements to be approved for moral character and other felony provisions.
Thank you so much. And so, just to be clear, it sounds that the current the current requirement right now is a bachelor levels degree, and it sounds like there's probably a national accreditation exam that the licensees have to take as part of the administration before they proceed. Is that correct?
From my understanding, that's correct.
Thank you. And so, thank you. So just to be clear, so the proposal that you're doing right now is essentially to circumvent that current process and to, from my understanding, make it easier for dental hygienists who might not have the traditional training to be able to get licensed. Is that correct?
Chair member, this is not a Board of Dental Examiners sponsored bill. We're here to speak that this that we will see fit to execute how the legislature sees fit for the bill, but the board has not voted on this topic to have a position.
Thank you. I guess my following question is, to your understanding, serving on the board, how many states have implemented such a similar program?
To my knowledge, one, the state of Alabama, and I believe recently passed was the state of Florida from the information I've received, but I do not recall if it's been implemented yet.
Chair, committee member Stacy Weeks for the record. I would just say that I think what you have before you is a provisional licensure and an abbreviated process to try to get some services out the door in a more feasible manner than they are today, because we are not having the access that we need in this state, and that is what you have. And I think the concern obviously is when you abbreviate the process, you are shortening, it feels like someone's not going through the full process. So I think that's what we have here in front of us today. It does sound like someone from the Dental Association is here and can answer more details, probably about the requirements, Senator, if you would like.
Sure, go ahead, please proceed.
Good afternoon, Senator Dunyate, Assembly Member Brown May, and members of the Committee of the Senate and Assembly Committees on Health and Human Services. Thank you. My name is Dr. Amy Abitian. I am part of the Nevada Dental Association, but I can help add some color to any questions you might have.
Thank you. So walk me through the process of what is being proposed to do. So I'm assuming you're a proponent of the measure. So perhaps you can help me understand the context of what we're trying to enable. So this is establishing, for instance, if there was an assistant that worked in the dental office that wanted to become a dental hygienist, have a higher scope of degree or of ability to practice in the office to assist the dentist, this would allow them to do so without having to go through a formalized training education system. Is that correct?
Partially so. So there is a formal training that goes along with this program. There is going to be a curriculum defined by the board. There is going to be an examination defined by the board. But for the large part, the hands-on training would occur in the dental office under the supervision of a trained and calibrated dentist.
Thank you. And have you guys identified already what curriculum you would follow for these individuals and what specific exams that you would prescribe for these individuals as well?
Yes, the program that was prescribed by the governor follows the model of Alabama, which has used this program for 50 plus years safely and effectively, and has used their series of examinations and curriculum to not only train their dentists, to train these dental hygienists, but also to train the dental hygienists themselves.
Thank you so much. And then I guess the last question that I had regarding this section is, so we've had multiple bills this session that have dealt with bringing folks to be able to practice in this state, right? But there are requirements that they have to meet the same training protocols as someone that is going through the program as we're going to hear today. And so how do we ensure that we're monitoring the feedback that we receive and that we're actually putting out quality providers if this is a level of provider before being relinquished into the state and so forth? So what are the reporting mechanisms before we just enact such provision, I guess is my question.
Dr. Amy Abitian, for the record, Senator Dunyate. That would fall completely under the purview of the board. So it would be the expectation of the board and Mr. Higginbotham, who is the executive director of the board, to define how that reporting will occur. But it would be for the same as for any of us. There is a reporting mechanism for dentists, for dental hygienists, for any conduct within our offices, and any treatment within our offices.
Great. Thank you so much for answering those questions and for helping me understand that section. Any other questions from the committee members? Senator Taylor.
Thank you, Chair. And just excuse having to make a bill presentation, but it's that time of year. But this is actually the area that that I had most of the questions about, because this is the area I've received more emails than I ever expected on this particular issue. So I'm glad to be able to be a part of this. I mean, some of the, and you've had a chance, thank you so much, Doctor, for being able to address some of those concerns. Some of the ones that I continually hear is a concern from the hygienists themselves, frankly, that that the dentists don't have a full grasp on what they do, and so therefore, how can we expect the dentists to train them?
My simple answer to that question is that everything that is done in our offices, we as dentists are responsible for. So we are trained, more so than the hygienists, we are trained to a higher level, to a higher standard, and we are expected to know exactly what is happening periodontally with the gum condition, the bone, the health of our patients in our offices, and we are expected to treat appropriately. The idea that we don't know what we're doing, as well as the hygienists do, is a little galling.
I'm sorry. Let me. If I may
apologize
interrupt.
for that.
No, I didn't mean to. I didn't mean to say that the questions that dentists don't know what they do.
I see.
Please, no, please.
Okay.
Let me restate that. But that dentists don't have that great of a grasp on what the hygienists do. So let me clarify that. So please, there aren't hygienists out there saying dentists don't know what that's not happening.
Fair enough. From a personal point of view, my mom is a dental hygienist as well. She practiced for 15 years. I watched her go through the prerequisite training for dental hygiene school, through the dental hygiene school at TMCC herself. I know very well what is entailed by the training of a dental hygienist, and then what they see when they get out in the real world. I have had periods in my practice where I've practiced only dental hygiene, and I know the expectations and the demands of the job. I can say that every dentist practicing should have a perfect grasp of what periodontal condition is, what appropriate treatment means, and ensure that all of their patients are receiving that.
May I follow up, please, Chair? Thank you. And thank you. And this is not what I feel. I don't know enough about it. I just get my teeth cleaned. That's all I got, right? That's all I got. But I do get my teeth cleaned. So please, I hope that wasn't offensive. I wasn't trying. I really just want to be able to respond to those folks who are reaching out to me, and there are quite a few people reaching out. In layman's terms, if you would, what other than clean teeth, which we certainly know hygienists do a great job. Mine do a great job. If you're listening, hygienists, you do a great job. But what other support are dentist office receiving from the hygienist? Maybe that might lend some light to this.
Sure. Our dental hygienists in a lot of places can be extremely helpful to us. They do most of the data collection for our diagnosis of conditions within the mouth. So they collect periodontal or gum measurements every time you go through, and they do those little pokey measurements. They do that for us. They can make photographs, they can make impressions, they can do any of the 17 tasks that a dental assistant can do, plus the cleaning, scaling, instrumentation of patients. They can anesthetize, so they can numb, which is an extremely handy thing too. We appreciate that. But they have a lot of different facets that they can do within the office to support us.
Chair, if I may, one more. Thank you. I guess I'm making up for lost time since I just got here. So in that sense, how would you envision as this, if this program were to go forward, making up the hours, so to speak, there are what, 3,000 hours typically that the hygienists would get in their training, and so that wouldn't be the same if I'm understanding this correctly. It's so the target being dental assistants and then giving them an opportunity to move up, which I think is fantastic. How do we replace that 3,000 hours in those roles, doing those other things that perhaps your dental assistants aren't able to do right now?
Well, the nice part about that is these assistants have already had a lot of hands-on work. There is a certain amount of time that these dental assistants need to spend in the chair as dental assistants to be able to see and understand what's happening in the mouth and to understand the job that they want to pursue next. There would be established amounts of training time, hands-on, and there would be a prescribed didactic course that would need to be followed. So these folks are going to receive the didactic training that they need. They are going to be able to start on patients in the dental office and be able to work under supervision immediately.
Chair, I promise, final question, if I may. Thank you. So do you envision in going forward, because we know how certainly we need about every medical role in this state that we can get, certainly. So do you envision perhaps as the program is developed, as the board is developing the training, the exams and all of those, do you envision an opportunity to work with the hygienist so that there's a meeting of the minds in this, if you will, so we don't have a second-class citizen hygienist, if you will?
I really do hope so. I hope that that's the model that gets followed. This legislation provides for a sunset on this training program, meaning that in times where a dental hygiene shortage does not exist, which, by the way, that exists in every single county in the state currently, but at the time that a dental hygienist shortage does not exist, students cannot begin this program. So this is a stopgap measure. This is something to help us augment the numbers of practicing dental hygienists who can help us meet the needs of our patients. Now, would I love to see an expansion of the dental hygiene schools? Absolutely. But that would require quite an outlay from the state for expansion of the facilities and the programs themselves, as well as time for those students to matriculate from expanded programs.
Thank you so much, Dr. Chair. Thank you for your indulgence. I appreciate it.
Thank you. I just have two more questions on this because I want to make sure that we're on the same page. So it would be one thing if the bill said, or the section of the bill said, we have folks that are going to school not in the United States, have already completed a similar program to be a dental hygienist, is not recognized by this body, and we want them to get the same certification and licensure to be able to practice under the scope of supervision of a dentist. But what you're providing here is essentially someone to bypass the programming that we have already for the dental hygienists in this state in an effort to, say, improve the shortages that we have. But I guess my question is, if I read page 61, it says that the clinical examination as described in this is not required to be approved by the American Dental Association. And then now you're allowing in the later half of the bill that preventive agents such as what they can already prescribe under current law could be authorized for drugs and devices. And so I think that if we take a step backward, right, there's a reason why we require students to go through anatomy and physiology or OChem, right? It sucks. It's part of the everyday training that many of us who are pre-med and so forth had to go through, but it teaches you the fundamental principles of what medicine is or what it means to be a healthcare provider. And so I have difficulty to accept that if you're not requiring them to take the same exams as prescribed by the American Dental Association or as the same requirements that everyone else has to take, then how do we ensure that we're actually putting quality providers out without causing essentially a sort of madness in the state?
Well, I can lean back on the fact that this program has been functioning in Alabama for over 50 years without incident. And we know it works. Texas has recently also implemented an extremely similar program. The dentists who are training these programs are training calibrated or going to be training calibrated by a program prescribed by our board, and then our board should be regulating and should be monitoring provision of care within the state. our board's responsibility is to ensure the safety of our patients. And while us as dentists are responsible for the patient care that happens in our offices, it's up to the board to ensure that we continue to do that.
Thank you. Just one final note on this. I actually looked up the concerns that they have had in Alabama since the implementation, and most of it has been the comparison of what these folks are going through in the alternative training are not to the same extent as those who have gone into a formalized training. And so I think if this is to proceed, then that has to be rectified, because I don't want us to fall into the same situations as what we're experiencing in other states, or that other states are currently in the process of doing so. Let's go to Assemblymember Koenig, and then we'll go to Chair Brown-May.
Thank you, Chair. So, yeah, I don't think we envisioned this turning into a dental hygiene discussion, but I think I'm taking the bait here. So, I mean, I think the provisions here are to help with the shortages in the state now, and we keep hearing in the underserved places. Now, is there a hygienist shortage in Las Vegas and in Washoe, or just in Ely and Winnemucca? I mean, is it just out in the rural, is it a shortage, or is this just a shortage, or is it a shortage statewide?
This is statewide. This is in every single county. This is in all of our metro areas. Of course, any sort of provider shortage is amplified in our rural districts. Any sort of healthcare gaps are completely amplified in our rural districts. They are feeling it worse. But this does very heavily exist in Reno and Las Vegas.
Follow up, if I may, Chair. So I too received a lot of emails, and a lot of them were trying to protect their turf and make sure that someone couldn't come and take their positions. But if we were a state full of dental hygienists, and we found a way for other people to become hygienists potentially easier than they had, then there's the risk of them losing their positions. But if the state is a shortage everywhere, by bringing up more, we're not diluting what we already have. We're just trying to get to where we need to be. So that's kind of my take on that.
Would you like a response? Sorry.
That wasn't really a question.
Thank you. Let's go ahead. I have 3 more folks. I'm going to go back to Chair Brown-May, followed by Assemblyman Gray, and then Senator Titus. And let's try not to make it a dental hygienist hearing, please.
Thank you. I'm actually going to pivot away from dental and dental hygiene, but I do want to say thank you so much for your insight and your knowledge. I want us to go to data, specifically Section 7. And we do a comprehensive assessment currently of the needs with regard to healthcare workforce, although it's not inclusive of all. And there have been a number of sections that have been eliminated from this bill where we talk about or refer to the comprehensive assessment. So a couple of things. First, I want to make sure that we are still including a comprehensive assessment of where our healthcare professionals are and how are we going to identify where we need additional healthcare providers with regard to our healthcare workforce, which is, I believe, what we were trying to get at in this Section 7. Now that the appropriations have been eliminated from this bill, my first question is, are we still able to fulfill a comprehensive assessment of our healthcare providers so that we can concentrate on workforce?
For the record, Richard Whitley, I think Section 7 stays in the bill. We do receive, as I'm sure you're aware, the federally, the Health Resources Services Administration primary care funding that every state gets to assess workforce shortages that break out not only dental or oral health, but also primary care, and then subspecialties, and finally mental health by county. Those determinations are, and we do the work in the Division of Public and Behavioral Health on behalf of HRSA for that surveying of the workforce shortage areas. That's used foundationally for federal loan repayment programs, for determination of location of federally qualified health centers. So we're a part of that, and work continues. I think getting it at discussion that you've had over time in with how do we know who's working in Nevada? I think there is more work that we can do in that space with our Office of Analytics to actually determine just like you may be licensed here, but are you working? And are you working, what geographical area are you working in? John Peckham at UNR School of Medicine does an excellent report on workforce shortages. But to make that actionable, I think there's probably additional information that we could collect.
Thank you very much for that information. Do we currently have the data systems to collect this information and house it so that it can be actionable, that can adequately identify where we have workforce shortages in our healthcare system?
Stacy Weeks, the record, Nevada Medicaid Administrator. Yes, we are currently standing up an all payers claims database, which allows us to see every provider that actively provides service in this state that provides a claim in any payer market, except for obviously Medicare, I think is outside of that scope. But we will be using that database to really track and identify by specialty type where our providers are, especially if we're not catching them in these other survey methods.
Thank you, Administrator Weeks, for that. One more, Senator, if you don't mind. Thank you so much. So many times in this legislative body, we put a plan into action, and then we come back in 2 years, and we're partially there. Can we say relatively confidently that in 4 years, we will have actual data, because we will have had a 2-year biennium to implement this entire data set and then roll it out to our licensed medical professionals. So potentially in 4 years, we will actually have real data about who is practicing, where they're practicing, and if they're seeing patients so that we can more adequately build out our workforce for medical professionals.
For the record, Richard Whitley, I can't answer that in 4 years where we'll be and what capacity we'll have if we have to reduce. We do take, we incrementally make progress. I'm quite proud of our Office of Data Analytics. You'll hear in the next bill the proposal to move it to the proposed health authority where it can inform healthcare. That's been an iteration over a decade from categorical funding that we've cobbled together to be able to look at population health outcomes and disparities, and then the system itself. But we can't sit here today and say in 4 years we will have arrived at some place specific, but we will get better because foundationally we have the system in place.
Thank you, Director Oakley. That's exactly the question that I wanted you to answer. You're talking to me about categorical funding, and I want to make sure that we are adequately funding in order to be able to launch this data set, right? So we need to make sure that if this is important and we want to have data, that we are appropriately funding that mechanism. That appropriation was eliminated from this bill, so I want to make sure that we are all on the same page, making sure that we are giving you what you need to have in order to be able to roll this measure out. So thank you for that answer.
Thank you. Let's go to Assemblyman Gray.
Thank you, Chair. Good afternoon. Thanks for the presentation. I'm going to pivot back to the hygiene program thing. Sorry, Doc. I'm a supporter of it. I mean, we do need more out there. Getting a hygiene appointment's a pain in the neck right now with any provider. But going through the website for the state and stuff, nowhere in there did I see a requirement for a bachelor's degree. The requirements just came up that it was, you had to go to a CODA school, pass the exam, be of good moral fiber, yada, yada. So I thank you for answering that earlier. I know there was some consternation in the crowd, but nowhere on the website does it say there's a bachelor's required. Question I have, though, is having spent a lot of time in medicine and actually working with, the paraprofessionals and the technicians and stuff, I'm assuming that with this program, you guys are going to have practicals are going to have to pass, demonstrative, exams as well as written exams along the way. I mean, I can't see you guys just cobbling this together, but it's, can you elaborate on that?
Yes, absolutely. Dr. Amy Abitian for the record, Senator Doñate, Assemblymember Brown May, members of the Committee Health and Human Services. It would be our goal to not only work with dentists and dental hygienists to create the regulations with the board, but it would be our goal to create stringent regulations that define all of those benchmarks that any of these candidates need to pass in order to practice here in the state. So be it practicals, be it written exams, whatever we need to do to ensure the knowledge base and to ensure the safety of the practitioner, we'd like to do that.
Thank you. And we'll go to our last question from Senator Titus.
Thank you, Mr. Chair, and apologies for being on the wrong bill. That's what happens when you get late to a committee. I was presenting another bill, though. I, too, am kind of hung up a little bit on this dental hygienist because I also have gotten lots of emails on it. In other bills and other on our HHS committee, we've approached the issue of shortage of providers by doing a accelerated or different pathway for some of these specialists. Most notably, the psychologists. We had a bill that once you got your bachelor's, you could enter and do some testing in the schools. And so we're looking at bringing folks to the workforce at that earlier level. But these are all recognized professionals, and I'm curious about this particular one, about the different alternate pathway to licensure. Will they still have the same, is there billable places amongst this? Will they be able to bill for their services at the same rate? Is it reimbursable? I'm curious, and that's my number one question. Number two question, are they stackable? If the person then wants to go to that next degree, the next step, would they be a stackable credit like we do in so many of the other professions?
Senator Doniate, Assemblymember Brown-May, Dr. Amy Abitian for the record, Senator Titus. To answer your question, as long as the dental hygienist carries a license within the state of Nevada, that is the key portion that they need to be able to bill. They still bill under the supervision of a dentist, but they would be able to bill just the same as any dental hygienist within the state of Nevada. And then I think I need a little bit more clarification on your question of the profession being stackable. Are you referring to dental therapists? And what would that be referenced to?
Well, in a lot of nursing, for example, you start out as a nurse's aide or LPN and then an RN or a 2-year degree, and you can use some of those credits towards then advancing your degrees. And I'm wondering if this program then would be just the isolated single, this is what you do, or is there the next, like, well, a nurse practitioner then can advance practice nurse. So anything like that in the dental hygienist world?
There aren't too many things like that in the dental hygienist world. The dental hygienists can get a master's in public health and practice public health dental hygiene. They are able to go through further training and become a dental therapist. It would be up to regulation to see how they could apply those things. I would imagine if they were to go on and do the master's in public health, they could practice similar to that in that setting, but it would be up to regulation how these are treated.
Thank you, and thank you, Mr. Chair. I think we've taken a solid bite out of the dental issue.
Thank you. Unfortunately, we do have to move on just because we ran out of time for this bill hearing. I want to make sure that folks who have been waiting patiently get the chance to testify. And so I'm sure we have plenty of comments and suggestions to the bill post-hearing. And so at this time, I'll go ahead and open it up for support testimony. If you would like to provide support, please come forward in Carson City and Las Vegas. Because it is the end of the legislative session, I will be putting a time limit of 30 minutes in support and in opposition and in neutral. And we'll start here in Carson City. Please begin.
Good afternoon. My name is Carla Perez. That's spelled Karlaperez. I'm the Regional Vice President for Universal Health Services, which includes the Valley Health System of Hospitals in Las Vegas and Northern Nevada Health System in Northern Nevada. These systems represent 13 acute care, behavioral, ambulatory, rehabilitation facilities, and a rural critical access hospital. As part of UHS's leadership for over 40 years, I've seen changes to our healthcare system in this state that have been great and resulted in systems of care that we could be proud of. But we've also seen challenges. I'm here today to support Governor Lombardo's Nevada Healthcare Access Act, as I believe that SB 495 takes great steps in working to solve some of our biggest healthcare challenges. I had the honor of being asked to serve on the Governor Lombardo's Healthcare Committee, and I appreciate that SB 495 works to, among other positive changes, standardize prior authorization procedures that would ensure prompt provider treatment of those seeking health care and ensure that services that are rendered in a hospital setting will receive reimbursement. SB 495 also has many provisions that strategically address Nevada's critical workforce shortages. But through the proposed universal credentialing, we can ensure that individuals that we have recruited to the state and are willing to practice their healthcare specialty here in Nevada have the opportunity to begin that care sooner rather than later. I'm also very supportive that SB 495 includes increased funding to GME and expanding residency programs, although I know that that's been moved, and creates an Office of Mental Health to strengthen efforts in mental health services. Too often, hospitals become the only place available for a person in crisis to seek treatment. For these and other reasons, I would ask you to support SB 495, and thank you.
Chair Brown-May, Chair Dignate, and members of the committee, thank you for your time today. My name is Amy Hines-Sutherland, Hyne-Sutherland. I am NACO's Health and Human Services Manager. NACO, or the Nevada Association of Counties, supports SB 495. We anticipate that the creation of the Office of Mental Health will improve the state and local government's ability to coordinate effectively on behavioral health policy. The centralized coordination of strategic plans and policy recommendations will enable all of us to work together towards a common vision. Additionally, the provisions to provide training and technical assistance on billing and reduce administrative barriers to reimbursement are critically needed. Thank you.
Senator Dignate, Assembly Member Brown-May, and members of the Senate and Assembly Committees on Health and Human Services. My name is Dr. Amy Abittan, Abittan. I'm a practicing general dentist in Reno, and I'm here to represent the Nevada Dental Association, of which I'm the vice president. I wanted to express our heavy support for the entirety of SB 495. We are particularly excited about prior authorization clauses and non-compete clauses, as well as addressing the dental hygiene workforce shortage, which in our view is severe. I wish to express the frustration of dentists in the state in trying to hire and maintain dental hygienists. Here, it is so hard for us to be able to keep our patients in proper recall, to take good care of them, to ensure that we are doing all of the things to meet their needs. And we simply need more workforce. We want to ensure that our patients in both the metro and the rural areas are well served. It would be our goal to work heavily on regulation to ensure patient safety and to include the dental hygienist members of our profession in creating regulation to ensure stringent safety protocols. Thank you very much for your time today. We appreciate you.
Hello, Chair Dignate, Chair Brown-May, and members of the Joint HHS Committee. My name is Carissa Pierce, Carissapearce, and I'm representing Children's Advocacy Alliance. We are in support of SB 495 with particular emphasis on the creation of the Office of Mental Health to improve access to mental health care across the state for families and children. Families in Nevada are currently over-reliant on emergency services for mental health, which results in children being hospitalized repeatedly or sent out of state for treatment. Nevada needs a state-level leader for mental health, and the Office of Mental Health will provide that leadership and collaboration across the state, making it easier for families seeking mental health services. Improved access to health care and mental health care is imperative for child development because poor childhood health can impact school performance and have lasting impacts on future health and well-being. According to the Annie E. Casey Foundation 2024 Kids Count data, Nevada's performance in child health ranks among the lowest across the country, and we are grateful for this initiative to uplift our delivery of healthcare in Nevada. Thank you for the opportunity to provide testimony and for bringing this initiative.
Good afternoon, chairs and members of the Joint Committee. For the record, my name is Mary Beth Seawald. I'm the president and CEO of the Las Vegas Chamber of Commerce. The Chamber is supporting SB 495, and we thank Governor Lombardo for bringing this bill forward today. The Chamber supports SB 495 because healthcare directly impacts Nevada's businesses and the entire economy. Specifically, healthcare costs, access, and quality affect employee well-being, business productivity, and competitiveness. The Chamber seeks to promote policies that control costs, expand access, and improve the quality of care for Nevada's employees and their families. Based on those criteria, the Chamber believes that SB 495 will benefit both businesses and the overall economy of our state. SB 495 contains many key provisions that align with the Chamber healthcare legislative priorities. For example, Nevada Healthcare Workforce and Access Fund and programs, which will allocate $25 million and support efforts to address Nevada's shortage of healthcare professionals. The Chamber has advocated for legislation to retain existing healthcare professionals in our community, support programs that will attract healthcare professionals to the state, and funding to grow healthcare programs in our local communities. The Chamber also supports the provisions of the bill that relate to expedited licensing and credentialing for healthcare providers. By doing so, the legislature will be modernizing these regulatory processes, enhancing government efficiencies, and effectively addressing healthcare workforce shortages in our communities and helping our employees, their families, and most importantly, your constituents. In closing, the Chamber believes that the health of the community is intertwined with the health of our businesses, and that is why we ask for the Joint Committee to support SB 495. Thank you so much for your consideration.
Good afternoon. For the record, my name is Patricia Charlton, Chancellor, Nevada System of Higher Education. Thank you, Chair Danyate and Chair Brown-May and members of the Joint Committee. And she is in support of SB 495, and we support the bill's focus on strengthening Nevada's healthcare system. We're especially supportive of the proposed Office of Mental Health and efforts to expand rural behavioral health services. And she offers programs statewide and looks forward to partnering in this work. We also support the expanded role for paramedics and any work that includes our medical schools and partnership with our health partners across the state. And she is committed to improving access and outcomes through education, research, and innovation. Thank you.
Thank you. I'll take one more here in Carson City, please.
Hello. For the record, my name is Dr. Mark Funke, M-A-R-K-F-U-N-K-E. I'm a practicing general dentist in Carson City, Nevada, and I am in favor of SB 495 regarding dental care. I ended up changing this, so bear with me, just to try to help answer some questions. So with the Alabama model, a dental assistant would need to be an assistant for 3 years before moving on. I think people forget what these assistants learn. They are doing child prophies already. They're administering, placing fluoride, they're placing sealants, impressions. They have such an amazing understanding of dentistry because they're sitting side by side with us with all the treatment we do. They see any treatment changes that unexpectedly change. They see us treatment planning. They understand the options that we're getting. So they're getting a heck of an education. Whereas the hygienist, they aren't there for that. They're in a separate operatory performing the hygiene. They're not part of any of this other treatment, so they can lose a lot of sight on things like that. One of the hardest things a dental assistant can do is fabricate a temporary. Hygienists can't do that. That takes a heck of an understanding. It takes a couple years to get somebody up to speed for that. They have to understand the tooth anatomy, the bite, the musculature, the joints, when we're fabricating crowns. So with this, it's not such a big leap going to another program that's not so much dropping things, but it's just that they put some time in already for 3 years before even going to the program itself. And if I may add to the comment for Senator Taylor, it is a little disheartening to hear that we got an email from a hygienist stating that we don't know what the hygienists do. They work under our tutelage. One of the first things we learn in dental school is hygiene, periodontal gum disease, and we have to do all that treatment. We are trained on that. We have to test on all that. We're responsible for it. If there's a hygienist that can't get that piece of calculus here and there, guess who they go to? It's us, the doctor. Not only that, there's times we actually do these cleanings under periodontal gum disease.
Go ahead and wrap up your remarks.
Sure. We have to actually perform some of those duties under surgery where we're flapping the tissue, exposing the root structures, and doing all this. And then you've got periodontists that go on specifically doing this. So
thank you so much, sir.
Thank you very much.
You have reached your time limit, and we will now go to Las Vegas, please.
Good afternoon. I'm Allison Netsky. I'm the interim dean at the Kirk Kerkorian School of Medicine at UNLV. I am here today also to share my support for the governor's health care bill. Improving access to health care involves people and process. This bill focuses on things that oftentimes are overlooked that have to do with making it a hospitable, easy environment for us to be able to provide care. That includes making it a hospitable environment to recruit physicians to Nevada, making it easier to get credentialing, and reducing some of the barriers for prior authorization and reimbursement. So very happy to second what you've heard today in really emphasizing how important those factors are. In addition, being a psychiatrist, I would like to also support the great need for the Office of Mental Health and to speak firsthand to how much impact these coordinated early intervention services can have on the health of our entire state, and we'll be able to see the benefit in every part of Nevada. Thank you.
Good afternoon. I'm Dr. Wolfgang Gilliar, WOLFGANG-GILLIR. I serve as the Dean at the College of Medicine of Touro University, Nevada, where we graduate 170 students each year. At Touro, we are deeply committed to educating and retaining physicians and health professionals, including PAs, PTs, OTs, and nurses right here in Nevada. This year alone, we graduated 55 students that became doctors who will enter residency programs right here in Nevada. Our long-term goal is to grow that number to 100 per year. So over the next decade, that we would actually mean 1,000 new physicians dedicated to our communities here in Nevada. That's why we strongly support Senate Bill 495. This legislation represents a much-needed public-private collaboration to expand our healthcare workforce and improve access, especially in underserved areas. We are grateful to the Governor's Office for including private nonprofit institutions like ours in crafting this initiative. Provisions in SB 495, like accelerated licensure and rural incentives, reflect a comprehensive solution of Nevada's provider shortage. We teach this from day one in medical school, that we are here to provide for greater good and for the public, and we want to retain our students in the state. We respectfully urge your support for this important bill. Thank you very much.
Good afternoon, Chair Doniate, Chair Brown-May, and esteemed members of the Health and Human Services Committee. My name is Dr. Rupesh Parikh, R-U-P-E-S-H, P-A-R-I-K-H, and today I am here to express our support of the Nevada Healthcare Access Act. As the practice president of Comprehensive Cancer Centers of Nevada, I want to specifically speak to the Act's provisions regarding non-compete covenants, grant allocations, and prior authorization, along with credentialing. We all recognize that Nevada faces significant challenges when it comes to healthcare provider shortages. While we know that the proposed amendment of GME will move to Senator Pezzina's bill, we are in full support of the GME program and any innovation forward. Beyond our ability to recruit and retain our physicians, the credentialing process continues to be a burden for our new recruits coming into the state. It can take 6 to 9 months. We simply want to make it easier for those doctors that we've trained and that we recruit to come back to Nevada. SB 495 provides a robust framework to support these efforts. It revises the healthcare providing credentialing process and establishes a competitive funding program aimed at addressing these critical shortages. The Act aligns perfectly with our goals at Comprehensive Cancer Centers, especially its emphasis on prior authorization and reform of the Gold Card exemption program, which are vital for ensuring that timely and life-saving patient and cancer care treatments are not delayed. Moreover, the Act's provisions on reasonable reforms to the non-compete covenants are essential. These reforms balance fair business practices and protect healthcare providers' interests, ensuring that we create a professional environment attractive enough to draw interest from our best talents. In closing, I firmly believe that supporting this bill is necessary in the legislative process. We can build a robust healthcare system that truly meets the care of all Nevadans. Together, we can make Nevada a better place for healthcare. And tired of hearing, I want to leave the state to go for my healthcare. Thank you for your attention.
Good afternoon, Chair Donate and Chair Brown-May, and members of the Senate and Assembly Committee on Health and Human Services. For the record, my name is Anna Wood, A-N-A-W-O-O-D. I'm Government Affairs Chair and member of the Board of Directors of the Las Vegas Asian Chamber of Commerce. I am here in support of SB 495, Governor Lombardo's Nevada Healthcare Access Act. Healthcare provider shortage has been an increasing, ever-growing, long-time concern to Nevadans. Year after year, we address this shortage. It is time we act as one and find solutions to what concerns our communities, local, rural, and underserved, where these shortages are prevalent. Long appointments and insurance delays are quite burdensome, not only to the individual who's seeking medical care, but to those in the hard-to-reach rural areas and hardworking communities. Nevadans deserve qualified, efficient delivery of healthcare services and improvement in providing accessibility to mental health services, as well as dental services. Reforms will ensure patients get the care they need. I urge your yes vote on SB 495. This affects all Nevadans. I thank you for your time and consideration.
Good afternoon, Chair Donate, Chair Brown-May, and esteemed members of the Committee on Health and Human Services. My name is Helen O'Hanlon, and I'm here to share my story as a stage 4 cancer patient in support of the Nevada Healthcare Access Act. I've been actively fighting a rare form of ovarian cancer for 18 years called granulosa cell tumor. I moved back home to Vegas in 2017 after fighting 10 years with over 12 surgeries, 3 different chemos, after top hospitals in both Chicago and Houston told me there were no options. We moved back home to Las Vegas to be with family and friends for end of life. In 2017, I established care through Comprehensive Cancer Centers of Nevada. My new oncologist, Dr. Parikh, along with Dr. Curtis, a radiation oncologist, created a plan for a rare ovarian cancer using CyberKnife, direct pinpoint radiation, delivering thousands of rays, never hitting the same area twice, but always hitting the target. With nothing to lose, we did it. Here I am 7 years later, thriving and living life. As a UNLV graduate, I love being back home, and I don't think I'll ever leave again. But last year, my cancer returned with a large tumor. Although my insurance had previously approved treatment, it denied it this time. My doctors had to appeal, delaying my treatment, which was stressful. I was once again in that fight for my life situation, except this time it wasn't because I had no options. It was because of delays, insurance approval. By the time my treatment was approved, my tumor had grown beyond the size of what the CyberKnife machine could do. Carefully, we did it anyways. Time is important for a cancer patient. Testing is showing we got it, and we'll know in a few months. My story exemplifies the importance of supporting the Nevada Healthcare Access Act. We need prior authorization reform to ensure patients receive timely care. Nevada has excellent doctors, but we need more. As cancer becomes a chronic illness, patients are living longer, and access to care is crucial. Let's support this act to improve healthcare access and ensure patients like myself get the care they need without unnecessary delays and close to home.
Chair Senator Donati and Chair and Committee, my name is Diane McGinnis, D-I-A-N-E, M-C-G-I-N-N-I-S. I have a DNP and APRN degree, and my doctoral degree is in nursing. I have a personal practice in Beatty, Nye County, Nevada. I've also been a rural firefighter there and a paramedic here in Las Vegas in the past. I'm here to represent the Nevada Nurses Association. I'm the Vice President and Legislative Committee Chair. We are in favor of the bill. Some points: prior authorization. As a provider, I know what my patient needs. When I put in a prior auth and it's refused, I then need to guess what wording I need to use to get the procedure or medication to get approved. It would be amazing to have the gold card as an innovative way to address this roadblock. As a prior nationally certified paramedic, I also want to address a part of the bill to promote EMTs and paramedics practicing in facilities. This is especially important in rural areas. Sometimes we just need an extra skilled hand, or the EMS provider needs some hands-on skills time. We support expedited credentialing as well, and we ask that when regulations are developed, that funding for nursing education expansion also be considered. Thank you.
Good afternoon, Chair Danyate, Chair
My
Brown May.
apologies. Let's go to the phone line. Sorry.
To testify in support on SB 495, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chair Danyate and Chair Brown May, members of the Senate and House Assembly Committee on Health and Human Services. I'm Dr. Nehal Naik, that's Nehal Naik. I'm a board-certified emergency physician and a member of the Nevada State Medical Association, and I serve patients throughout the Las Vegas Valley. I'm here to express my strong support for SB 495. I'm particularly supportive of prior authorization reform. As a physician practicing in Nevada, I witnessed firsthand the serious harm caused by our current prior authorization system. Every day, patients experienced unnecessary delays in care due to unnecessary bureaucracy. The delays aren't just inconvenient, they can lead to worsening conditions, unnecessary suffering, and poorer health outcomes. We already face in our state a severe physician shortage. We can't afford to have our limited number of doctors spend precious hours on the phone again, fighting with insurance companies, instead of being where they're needed most, which is with patients. The consequences are real and alarming. A colleague of mine recently shared a heartbreaking story of a 6-year-old patient who had failure to thrive, meaning he wasn't growing well. He'd been given Megestrol to help with his appetite stimulation and return to normal growth. Partway through, the insurance company stopped covering treatment. My colleague made numerous appeals, all while this child started to get worse. This affects everyone. I, as an emergency physician, can navigate the healthcare system well. However, my own mother waited 6 months for an MRI of her back due to prior authorization, with my and her oncologist concerned for return of her breast cancer. She waited and waited for prior auth while she'd being told she needed other therapy like physical therapy for her back pain. She lost significant weight, had increasingly weakness. I had my mother go to the emergency department and I discussed with the ED doctor my concerns. That MRI showed what we had all feared, metastatic breast cancer to her spine, ribs, and right arm. Due to her persistent pain and debility, she was admitted to the hospital. This emergent care could have been avoided with timely intervention. When patients are denied or delayed care, they often end up in ERs like mine, in worse condition than when they first sought help. This bill addresses the inefficiencies head-on by streamlining the process, dramatically reducing wait times for prior authorization approvals, and ensures that patients receive timely and appropriate care without unnecessary stress or delays. It allows doctors to spend more time at the bedside and less time on the phone.
Thank you so much, sir, for your comment.
Yeah, I urge you to support the bill.
Thank you. AVH, next caller, please.
Yeah, dear members of the Senate and Assembly Joint Committee on Health and Human Services, my name is Jill Douglas, Douglass. I'm writing in strong support of Senate Bill 495, a bill that takes meaningful steps to improve health care access for all Nevadans, especially those in rural and underserved communities. This bill is about delivering better, faster, and fairer care to all Nevadans. For far too long, Nevadans have struggled to access the care they need, not because we lack compassion in our healthcare system, but because outdated bureaucracy barriers have gotten in the way. SB 495 delivers real, common-sense solutions. The bill expands telehealth and mental health services statewide, ensuring that distance and location no longer determine whether someone can speak with the doctor or get vital mental health support. It simplifies Medicaid access and cuts through the insurance red tape that too often delays treatment and discourages providers. This means faster care for patients and fewer administrative burdens for our doctors and nurses. SB 495 also fast-tracks licensing for healthcare workers in high-need communities. That's not just smart policy, it's urgent. We have qualified professionals ready to serve, and this bill helps get them where they're needed most. And finally, this legislation modernizes healthcare oversight, streamlining credentialing and prior authorization processes so care isn't stalled by paperwork or antiquated rules. SB 495 isn't about politics. It's about people. It's about improving outcomes and cutting delays and ensuring Nevadans get the care they deserve when and where they need it. We must come together to support real solutions. I urge you to support SB 495 and help us move towards a stronger, more responsive, and more equitable healthcare system for all. Thank you.
Thank you so much. AVH, I'll take 2 more online, please.
Hi, my name is Marvelyn Navarro, and I am here to strongly oppose Section 77 to 79 of SB 495. Let me share a real story. A patient came in for a routine dental cleaning. During the visit, their licensed dental hygienist trained in pathology and in performing thorough intraoral and extraoral exams, identified an enlarged lymph node. She educated the patient and referred them to a physician. Months later, the patient returned with tears in their eyes, thanking the hygienist. It was stage 4 lymphoma. That referral may have saved their life. This is what dental hygienists do every day. We are not just tooth cleaners. We are preventative healthcare providers who spend 60 minutes with patients multiple times a year, more than most healthcare professionals. This bill proposes replacing years of accredited education with vague, on-the-job training without clear standards, curriculum, or oversight. The Nevada State Board of Dental Examiners has not drafted or voted on any language for this bill, yet it's being pushed forward without the proper process or public protection in place. What's more, dental hygienists have long been restricted from expanding their roles. Unlike nurses who can grow into nurse practitioners, dentists continue to regulate and limit our ability to advance, yet this bill removes regulation entirely for an unlicensed individual. It's not only inconsistent, it's unsafe. Going back to Governor Lombardo's testimony earlier, would he have trusted an on-the-job trained physician to operate on his loved one who needed emergency surgery? I don't believe so. So why are we considering lowering the standard of care for Nevada families? I urge you to strike the section or reword or find proper process for public protection. Thank you.
Thank you. And that comment was in opposition to the bill. We are still in support. I will take 2 more online in support of the bill.
Dear members of the Senate and Assembly Joint Committee on Health and Human Services, my name is Peter Guzman, and I have the honor and privilege of being the president of the Latin Chamber of Commerce, Nevada. I am calling in strong support for SB 495. I'm going to echo a lot of the comments and respect people's time, but I want to say this is a much-needed step forward. This is absolutely moving us forward. I commend Governor Lombardo's leadership on this issue. It is exactly what Nevada needs to build a more sustainable and accessible healthcare system and help our businesses that are struggling. Again, SB 495 is a much-needed step forward, and I urge your support and your vote in favor of SB 495. Thank you.
For the record, this is Jacqueline De Hoya, JACQUELINE-DEJOYA. Good afternoon to the committee. I am a president of a nonprofit organization called NAFA Nevada, the National Federation of Filipino American Association of Nevada. As you know, our Filipino community has a large number working in the healthcare sector. Therefore, this bill is very important to our community. We support Bill 495 as we need to improve healthcare in Nevada by addressing shortages in healthcare professionals, improve wait times for appointments and referrals and prior authorizations, and providers to be reimbursed for their work. Lastly, I would like to also mention that I have a son who's a recent graduate as a doctor, currently doing his residency in California. I hope these changes that we're making is attractive for him and other doctors who are currently doing their residency in other states. And I would like for my son to come back to Las Vegas and be part of our community. Thank you for your time. Please support Bill 495. Thank you.
Thank you so much. That concludes our support testimony. We will now, if folks can take a step back, we will now move on to opposition testimony, and I will allocate 28 minutes for this one since we already had someone speak. If folks can come forward in Las Vegas as well. And we will begin here in Carson City. Please begin when you're ready.
Good afternoon, Senator Donate and Assemblyperson Brown May. For the record, my name is Karen Soley, Carynsolie. I am a registered dental hygienist, and I am the co-chair of the Nevada Dental Hygienists Association Government Affairs Committee, and you all have received at least 2 letters and emails from me over this. I think I would like to just read a brief statement and maybe help answer some questions. I do appreciate that the committee is recognizing the hours of dental hygiene education. And so on behalf of the 1,622 dental hygienists in Nevada and the 220,000 dental hygienists in the United States, I thank you for recognizing that dental hygiene education and our capacity for service has been safely treating patients for over 100 years. We recognize that there is a workforce shortage, and we have actively worked with legislation this session to try and find multiple solutions. We looked at AB 143. We worked with that with Assemblywoman Kasama to work for licensure, Marzola was that one, for licensure portability. And we also have worked with AB 334 to enhance licensure by endorsement. We also are very firmly committed to working towards enhancing the existing dental hygiene workforce efficiency and productivity by seeking more autonomous regulations and removing the supervision barriers that hinder current dental hygienists from providing services that we are fully educated, licensed, and certified to deliver in all settings. So we are asking that you would strike section 77 through 79 and the things that pertain to this pathway, and be more specific in regards to the education and the requirements that my previous person from Las Vegas mentioned. Thank you.
Thank you so much. Let's go to the next one here in Carson City, please.
Good afternoon, Chairs Donate and Brown May, and members of the Health and Human Services Committee. While SB 495 promotes a variety of positive, for the record, thank you. For the record, my name is Lee Annette Lincicome. The last name is Lincicome. While SB 495 promotes a variety of positive health care provisions, as a licensed registered dental hygienist in the state of Nevada, I very strongly oppose sections 77 to 79 of SB 495 because these sections would eliminate, as written, the educational safeguards and standardized competency examinations that ensure practicing dental hygienists in the state of Nevada provide competent, safe, and comprehensive preventive and periodontal care to their patients. The alternative educational pathway to licensure proposed in this legislation, as written via on-the-job training by a supervising dentist, puts at risk the competencies required to provide safe, effective, evidence-based care, competencies that are grounded in rigorous academic and clinical training through a Commission on Dental Accreditation, CODA, accredited dental hygiene programs. The general dentists do not receive extensive clinical dental hygiene training in their dental school atmosphere where the emphasis is on restorative dentistry. Eliminating the requirement for a formal accredited dental hygiene education and standardized competency examinations jeopardizes the health and safety of the very patients hygienists are committed to caring for. Current educational accreditation standards in the state of Nevada are not arbitrary obstacles to candidates seeking licensure. They are essential safeguards that ensure patients receive safe, high-quality, equitable dental hygiene care. The citizens of Nevada deserve no less. Please amend SB 495 by striking sections 77 to 79 to protect the educational standards of the dental hygienists in Nevada and the health and safety of our citizens. Thank you.
Thank you so much. Let's go to the next one, please.
Thank you, Mr. Chair and members of the committee. My name is Helen Foley, and today I am representing Delta Dental. Delta Dental represents 275,000 enrollees and their dependents in Nevada. And also, we work very closely with 2,123 dentists. We are not here to address anything in the bill except for Section 126. And that repeals two very important statutes that they were created by this legislature in 2021 and came from NCOIL, which is the National Conference of Insurance Legislators. With dental insurance, it's very different from medical insurance. So when you have a bill and it says medical and then you just say and dental and think that everything's going to be fine, it causes a lot of problems. Dental insurance takes care of preventive care, very basic cares, and some major dental care. But there are always maximums yearly on how much an individual can spend on that dental care. Most of them, and I would say about 81% of the plans that people choose, have a range of $1,000 up to $2,500. I know that there are some legislators that have much higher insurance that we discussed in other hearings, but they pay more too. What has happened here with the bill repealing these two sections, if someone received a prior authorization, and then let's say it was good for a certain period of time, and then over the course of the year, they used up their maximum allocation of what they had, the dental insurer would then be responsible for whatever that prior authorization costs. This is not how dental plans work. They're very different from medical. And I certainly encourage you to discuss with Adam Plain, other members of the insurance division, the difficulties in enacting this language. Thank you very much.
Thank you, Ms. Foley. And perhaps it would be warranted to have a conversation after this to go more into detail about the sections that you mentioned. Anyone else in Carson City in opposition? Anyone in Las Vegas? AVH, is there anyone online?
To testify in opposition on SB 495, please press star 9 on your phone to take your place in the queue.
Hi, for the record, my name is Jessica Wilson. I am a registered dental hygienist here in Las Vegas, but I would like to address the committee as a mother of 4 children. Before I was a dental hygienist, I was a high school dropout. I worked at the gas station for $7 an hour, so it goes without saying that I was on Medicaid. At that point in time, we did visit a pediatrician's office for my child's dental care. This pediatrician's office did allow the assistants to scale with instruments my children's teeth. At the time, I was not educated enough to know the difference between an assistant and a registered dental hygienist. However, my children were educated enough to understand that their teeth did not feel clean after these cleanings. Granted, this dentist, I do not believe, was trying to provide an adequate care in any way, shape, or form, but a dental office is not a place to train anyone to do such skillful work. They are busy, they are hectic, the dentists are often responsible for multiple patients at one time. So I would I balk at my children having to have this care in the future, or my grandchildren having to have this care in the future as a Nevadan. As a dental hygienist, there's parts of this bill that I also do not agree with. Part of this bill says that one of these assistants, or whoever it is that they're training, can get a provisional license after they've completed their training, but before they've undergone any examination. And part of the examination that they can go under is provided by the dentist doing the training. One of the biggest things about our accredited programs is we have third parties testing our clinical skills before we are able to practice on patients in a clinical setting. So that's my opposition.
Do I speak now?
Please proceed.
Do I speak now?
Please proceed.
Oh, please proceed. My name is Florence Jameson, FLORENCE, JAMESON. Thank you, members of the legislature, for allowing me to speak with you about Bill number 495. I am speaking in opposition to SB 495. I'm an obstetrician practicing for 40 years, and our state AMA senior delegate, but today I'm speaking on behalf of myself, not organized medicine, and fellow Nevadans. I'm opposed to SB 495. This law would obligate the state to impose prior authorization rules created by the Council for Affordable Quality Health Care or its successor organization. CAQH was formed by a number of the nation's largest health insurance companies with the goal of creating a forum for healthcare industry stakeholders to discuss administrative burdens, physicians, patients, and payers. Now it wants to get into our Nevada law as a part of our prior authorization process, and I oppose this. CAQH members include Aetna, Anthem, Blue Cross Blue Shield, Humana, Kaiser, Permanente, United Health Pro, and many, many more. You know, Congress finally acknowledged that our patients' messages and cries for help. It found that the use of prior authorization in Medicare Advantage plans has skyrocketed, reaching 46 million requests in 2022, burdening healthcare providers and delaying care. With 46 million requests for Medicare Advantage plans alone, these plans were found guilty of corporate malfeasance. The CMS rule for 2024 aimed to regulate government health plans, reduce prior authorization timeframes, and enhance transparency. The CMS rules and other government entities are rules Nevada must follow. We do not need the insurance company's entity, the Council for Affordable Healthcare, to be written into our laws as our guiding light. Many insurance companies function as a vertically integrated healthcare system. They operate their own mail-order pharmacies, pharmacy benefit managers that can inflate costs of cancer and HIV treatments up to 1,000%. They own hospitals and are the largest employers of physicians in the U.S., resulting in significant vertical monopoly. These insurance companies are massive monopolies and oversee millions of patients and generate billions of profits. Bill 495 will allow these massive vertically integrated healthcare systems to be incorporated in Nevada law.
Thank you so much for your comment.
We must level the playing field.
If you can go ahead and please
we must
complete your
level
remarks.
the playing field. Thank you.
Thank you. Next caller, please.
Caller with the last three digits, 099, you may proceed.
Good afternoon, Chair Denote, Chair Brown May, and committee members. For the record, my name is Brenna Reynolds, BRENNAREYNOLDS. I'm a dental hygienist in Clark County, Nevada. I'm also a member of the Nevada Dental Hygienists Association. I ask that the Health and Human Service Committee consider removing language introducing alternate pathways for becoming a licensed dental hygienist in sections 77 through 79. I'd first like to clarify that while a bachelor's degree is not required to be a hygienist in the state of Nevada, the only two programs in the state, one in Reno and one in Vegas, only graduate students with bachelor's degree in their current programs. Current hygienists have extensive knowledge in pharmacology, head and neck anatomy, radiology, pathology, local anesthesia, nitrous administration, and nearly 3,000 hours of education and direct clinical care. I'd like to also state that while dentists are aware of what hygienists do and their scope of practice, their instrument knowledge and instrumentation skills are very different. We spend many hours perfecting that skill below the gum line using tactile sensations and no vision, just a different area than dentists, as they're experts in restorative dentistry. Assistants are in the restorative field, and while I support their expansion within their respective scope of care, hygienists are in the preventative scope of care in the office, and together we complete the puzzle. So removing the current quota accreditation requirements will create a large margin of precision in instrumentation standards, and without proper training and benchmark for licensure and the 5 national boards that current hygienists have to pass to be licensed, this is a huge concern for the public, and I'm against Section 77 through 79 and lowering the standard of care for fellow Nevadans, you, the public, and your loved ones. Thank you.
Hello, my name is Brenda Rosales, Rosales. I'm here today to oppose the Bill 495, Sections 77 through 79. I am a recent dental hygiene school graduate, so recent in fact that it was last Monday that I graduated. And I'm here to just really speak to the intense journey that is becoming a dental hygienist. In dental hygiene school, we didn't just learn how to clean teeth. We learned a lot about critical thinking, patient assessments, as to what Ms. Brenna spoke to earlier, pharmacology, so we know and we're ready for any type of medical emergencies in our care, pathology, so that we can be aware of any malignancies and that we can detect them. Oral cancer is completely treatable if caught early. And if we are not putting our hygienists through these didactic courses, unfortunately, our citizens will suffer and not be able to get that preventative care that they need. We also learned about ethics, radiology, pain management. Really, the list, it goes on. But truly, we practiced, we tested, and we were held to a national standard to ensure that we could safely and effectively take care of our communities. And the idea that someone can be trained on the job to do what we do really undermines not only the education, but our profession, and puts Nevadans at risk. Our patients deserve providers who are trained comprehensively and rigorously, and our licenses represent a commitment to health and safety. It's not just a skill set. Thank you.
Chair, there are no more callers in opposition at this time.
Thank you. Anyone else in opposition, either in Carson City or in Las Vegas? Let's move on to neutral. If you would like to provide neutral testimony, please come forward.
Good afternoon, Chairs Brown-May and Dunyate and co-joint committee. For the record, Shelley Capurro, representing the Nevada Association of Health Plans. And we want to thank you for the opportunity to provide neutral testimony on SB 495. We appreciate the governor's commitment to long-term strategies that strengthen Nevada's healthcare system and value the engagement of both public and private stakeholders. While we may not align on every provision, we are grateful for the collaboration that we've had, and we remain committed to working together as the bill moves forward. SB 495 proposes changes to prior authorization, including shorter turnaround times, electronic processing, and a gold card exemption program. We understand and respect the intent to reduce administrative burden and improve timely access to care. At the same time, we respectfully note that prior authorization remains a critical cost management tool. It helps ensure care is safe and appropriate while supporting sustainable coverage and affordability, and may prevent unnecessary procedures and promote the use of evidence-based therapies which lead to better outcomes. Some provisions, such as broad exemptions and tight timelines, may inadvertently undermine that balance. We share the goal of expanding access and advancing effective patient-centered policy. Again, we thank the governor, we thank the governor's staff, and we thank you for your time.
Thank you. Please begin. Shut your mic, please. Thank you.
Hello, my name is Tiana Brzezinski. I am reading this on behalf of the founder of our nonprofit, Dr. Whitney Bryant. My name is Dr. Whitney Bryant, and I am the founder of Sagebrush Smiles, a nonprofit mobile dental program serving children in several rural counties across Nevada. I am here today to speak to the very real and urgent implications of not having access to routine dental hygiene care, something to many of our communities face every day. In our school-based programs, we routinely see middle school students 12 to 15 years old who have never had a cleaning, not once. They've gone their entire lives without a dental visit, not because they're avoiding care, but because there's no one available to provide it. Several counties in Nevada, Esmeralda, Eureka, Lincoln, and others have no dental hygienists, and in many more, the number of providers is nowhere near enough to meet community needs. These are officially designated dental health professional shortage areas, and it shows in the untreated decay, in the chronic pain, and the systemic infections we see every week. As a licensed dentist, I want to be absolutely clear. We are fully trained and qualified to perform every preventative, restorative, and diagnostic service in the dental office, including dental hygiene. In fact, we set the clinical standards. Dentists are the top of the dental care team, and we are more than capable of supervising and evaluating the skills of those who provide care under us. In many rural practices, dentists perform all of their own hygiene simply because there are no hygienists to hire, despite months or years of open job postings. We are not asking to lower the bar. We are working to create a path that allows us to meet the bar in communities where there's no care at all. Thank you for considering what is already happening in rural Nevada and for supporting thoughtful steps that address these real preventable gaps in care. Thank you.
Thank you. Anyone else in neutral on this bill? I don't see anyone here in Las Vegas. AVH, is there anyone online?
To testify in neutral, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chair Doñate, Chair Brown, May, and members of the Committee of Health and Human Services. I had my hand raised and opposed. Am I allowed to speak, or should I just hang up?
Thank you. Unfortunately, we have passed time for opposition, but you are more than welcome to send your testimony in written to the committee secretary. AVH, is there anyone else neutral, please?
Caller with the last 3 digits, 301, please press star 6 to unmute yourself.
Hi, committee members and Chair Doñate. I had the same issue. My hand was raised for opposition. I didn't know if I just was skipped or if the time ran out for opposition, but it seems like the time ran out.
Thank you. Once again, we have already closed opposition, and so you're more than welcome to send your testimony in writing to the committee secretary. AVH, is there anyone else online?
If you've recently joined the call and would like to testify in neutral on SB 495, please press star 9 on your phone to take your place in the queue.
Hello, thank you everybody for the chair and the committee meeting today. I am testifying in neutral today for SB 495. My name is Angela Martin, Angela Martin, for the record. I am the current president of the Southern Nevada Dental Hygiene Association. I'm calling in neutral today because I do believe in SB 495 for all of the other sections, and I'm kind of on the fence for everything. I just wanted to clarify a few things. Testifying in neutral for this is that there were some inaccurate things that have been said, and I wanted to address something that Senator Titus had said about stacking. Actually, with us as dental hygienists, stacking a degree, if we were to go to another state or a different school and try to get a higher degree based off of this bachelor's or based off of our quote hygiene license that would be granted to us here in Nevada by attending zero schooling, if we were to go to try to get a master's degree, we would not be able to stack those degrees because they do require a Commission on Dental Accreditation actual degree from an actual dental hygiene school rather than just a dentist trying to train patients in the office. Some patients, are for this to come on in for wait times, but other patients tell me personally that they don't care about wait times, that they want somebody that's qualified for this position. Dental assistants are a lot of times qualified to do certain preventive services. However, they are not qualified to pass all of the standards that dental hygienists are. But I would like to say in place that for California, the Dental Hygiene Board of California has a business professions code, Section 1917, to where the students who graduate in a California dental hygiene school and they pass through it, they don't need to take an extra licensure exam in order to get a license in the state of California. So I'm thinking that a possible solution might also be to where if Nevada can propose something to have us make it easier for dental hygiene students from other states, such as California, New Mexico, Utah, Idaho, and Arizona, to where we make it easier for those students to come here and potentially not have to take the additional licensure board as well. That would mean that their graduation from the program is actually sufficient in order to get a license here. And that would be one of the big solutions that has proven effective in California that we could potentially use here in the state of Nevada rather than lowering our standards. It would also be great if we could have some more collaboration with the Dental Association. At this point, we're unable to place fluoride in the state of Nevada at a homeless shelter. But if we get trained by a dentist, we'll be able to have a license. So it just kind of doesn't make sense. If we're ready.
Thank you, ma'am.
Thank you very much.
Thank you so much for your comments. If you can connect with our committee secretary after the hearing, I would greatly appreciate it because I think there might be some follow-up conversations we can have with you. AVH, is there anyone else on neutral, please?
Chair, there are no more callers in neutral at this time.
Thank you. Let's go ahead. So do you have any closing remarks? No? All right. We'll go ahead and close this bill hearing and move on to our next one. And so I'll go ahead and open up the bill hearing on Senate Bill 494. And this bill makes revisions relating to health and human services. And so I'll invite back our presenters. Please begin.
Hello again. For the record, Richard Whitley, Director for the Department of Health and Human Services, and with me is Stacy Weeks, the Administrator for the Division of Healthcare, Finance, and Policy. We're here to present Senate Bill 494, an agency reorganization bill. Some of you who've served on budget subcommittees may have heard our intention here as it's embedded in some of the fiscal decisions that were made in our organization. As you know, currently DHHS is a very large agency. We have over 7,000 employees, but I think the complexity is actually in the functions that we fulfill, which start with eligibility. So for services primarily to Nevadans who are lower income, we do eligibility for SNAP, WIC, TANF, Medicaid, and then we pay for health care largely through Medicaid, and then put out grants to community providers and another kind of oversight and assurance. And then we regulate healthcare that we fund. And finally, we deliver direct services. And during the pandemic, it's been a challenge, I think. It really came to the forefront that on both sides, we could do better. And so we've worked for the past year and a half really on looking at how to do this in a thoughtful way. Is there a good time? There's never a good time to effectuate change that's needed. There's always a reason not to do it, but I think that our state is in a place of growth that has been incremental, that the capacity to actually break out the purchasing of healthcare and the oversight of the quality as one agency and the delivery, the safety net, the true safety net for service delivery, operating psychiatric hospitals for both children and adults, largely in involvement with the criminal justice system for competency, evaluation and restoration, that we really can't do all that we're required to do with having this split approach, that having the oversight for healthcare and providing it with our other hand is a challenge. And so you're going to hear today, primarily the focus will be, Stacey Weeks will walk you through what the health authority becomes. But I want to just say that what doesn't get highlighted as much is the opportunity to look at the direct service side of what we do. We should operate our hospitals in a direct service way with, I'll probably come to you next session if I'm still here to ask for flexibility to more corporately operate our health facilities and have some nimbleness in the workforce we struggle to hire for direct services. I do also believe that if we can get that building block structured, that we could benefit the Department of Corrections and the Veterans Nursing Home in Las Vegas. Both of those agencies also provide direct services. We face many of the same challenges. That's not going to be highlighted today. What you're going to hear about is primarily the creation of the Nevada Health Authority. But I just want to highlight that the other side of what remains in the Department of Human Services has an opportunity for a reset and an opportunity for us to improve how we serve as the state's safety net for service provision. So with that, I'm going to turn it over to Stacey Weeks, who's going to walk through the key components of the Health Authority.
Thank you, Director. Stacey Weeks for the record, Chair, committee members, Nevada Medicaid. So as Director Whitley mentioned, the bill in front of you, 494, would effectuate changing the division or the Department of Health and Human Services to Department of Human Services with the second agency known as Nevada Health Authority. This will serve as the state's single state agency for regulating, purchasing, and paying for healthcare services for Nevadans. And the focus would be improving overall health outcomes by building a sustainable and affordable system that is supported by an adequate workforce and sustainable resources and funding. These are all described in Section 18 of the bill, and it outlines the mission as well as all the duties and functions of the new agency. The new agency also will be purchasing coverage for a little over 1 million Nevadans there's the exchange portal. We also have the public option program through that portal, as well as Medicaid, and then the PEB program, the Public Employee Benefits Program. That's 1 in 3 Nevadans. It helps really leverage the state's buying power when it comes to purchasing and negotiating healthcare coverage for Nevadans. The new agency, like other state health authorities in Oregon and Washington, will be able to procure for healthcare coverage using a new specialized team of subject matter experts and national consultants to support the unique and often complex task of negotiating and contracting with health insurers. See Sections 24 and 79 for information about that purchasing strategy. And then described in Section 27, the authority will be responsible for establishing a strategic plan for purchasing health insurance for the programs within the jurisdiction of the authority. This plan needs to outline strategies for improving access to affordable quality care and controlling the cost to the state budget, and to present an update on that plan to the legislature and the governor before next session. And then biannually, the legislation includes coming back to the legislature and the governor with updates about the strategies and implementation. And then outlined, we do have a conceptual amendment or an amendment that we have brought forward to some of the changes in the bill. It is posted online. It is quite large. I was surprised that it's actually longer than the actual bill, but there really aren't that many changes in it. It's just that it is nicely done by LCB in a way that really incorporates the entire bill. But in that conceptual amendment, there is a new section in Section 27, a paragraph B, that will ensure the director of the authority will present the new plan to the Public Employee Benefits Program Board and ensure that we get their input and review and approval as we move forward, and that the authority will also allow the board to utilize the vendor resources of the authority to study various coverage options for PEB, which is our state employee coverage program, for employees as well as the Nevada State higher education employees and our retirees that are covered by the state. There will be 3 new divisions in the agency, and in front of you, you should have a handout. It's a one-pager org chart. It's just a high level. There's a much longer one that I did not send over, but the high level hopefully gives you a sense of everything. In the new agency, at the top of that org chart, you'll see various deputies, and at the bottom, you'll see the divisions and PEB, and we'll walk through those right now. So the 3 divisions are established under Section 18 of the bill. The first one is Division of Nevada Medicaid. Today, you might hear this called Division of Healthcare Financing and Policy. The bill is abolishing that name. It sounds like it's abolishing the whole division, but it is not. Nevada Medicaid still stands strong, and it will be the new Division of Medicaid. That is established in Sections 26, 34, 93 through 96, 113 through 117, and Section 359. It also ensures that this transfers the full responsibility for administering CHIP, which is our Children's Health Insurance Program, and Medicaid, to the authority. This includes eligibility and enrollment. The authority will serve as the state's single state agency for Medicaid for federal purposes. Every state has to have a single state agency, and the authority in Nevada Medicaid will stand as the single state agency for Nevada. Section 86 it permits the authority to delegate eligibility functions to other agencies or localities as needed to meet the needs of Nevadans. Currently, this would include the Division of Welfare and Supportive Services, which is renamed in the bill, and it still stays with the Department of Human Services. It'll be called Division of Supportive Service, Division of Social Services. Thank you, Director Whitley. There's a part of our amendment includes language to clarify and new paragraphs in Section 86. Paragraph 3 and 4 clarifies that if a county or locality would like to offer to conduct eligibility enrollment, there is a process. We would need to have an interlocal agreement, obviously mutually signed by all parties, and we would need to ensure that that locality is able to meet all the federal requirements and staff appropriately. This would obviously need to be approved by the federal government as well. So that's just clarifying that language for the counties because that did come up when the bill was released. Section 87 strengthens the state's efforts to root out fraud, waste, and abuse in our provider system, especially in Medicaid, by elevating these functions under a new office of Medicaid Inspector General that will be housed in the Division of Healthcare Purchasing and Compliance. Alongside this unit will include licensing and investigations for healthcare facilities, and along with compliance. This unit will be supported by a new regulatory and compliance attorney and independent from the entire program. The goal here is to avoid unintended and unfortunate, sometimes conflicts exist when you have your program overseeing compliance, is to ensure that we have that bias moved out of the program and that this is an independent unit. This unit will coordinate and refer cases to the AG's office like Medicaid does today, but it will be coming from this new office. Section 114, paragraph 2, also clarifies that any contract that obligates the state to expend any federal Medicaid funds on vendors, staff outside of the health authority must be signed by the director of the authority. This is to ensure appropriate oversight of all Medicaid funds that are used by the state, by other agencies and entities. Section 118 lays out the requirements associated with the agency's approved budget request. It was approved in closing to establish a process for real-time eligibility and plan shopping for our Medicaid enrollees through the exchange. The next division that's established under the bill is a Division of Consumer Health. This will oversee and support the administration of the Silver State Health Exchange, the Patient Protection Commission, and the new Medicaid Express for eligibility enrollment through the exchange, as well as the public option, and any other activities that be related to health promotion and health literacy. Sections 346 and through 348 place the exchange under this new consumer health division and section 348 adds that the 3 agencies who currently serve as ex officio members on the board for the exchange will be voting members. And therefore, the bill reduces the governor's appointments from 5 to 2 to recognize that there will be 3 new voting members from the executive branch. Sections 349 and 350 make revisions governing the terms and officers to ensure members serve 4 terms and to avoid consecutive reappointments over and over again. Section 352 allows the director to appoint the executive director of the exchange, and sections 351 and 352 clarify the roles of the board for the exchange as an advisor and support for operations and governance to ensure appropriate state oversight and accountability of this marketplace and the millions in federal funds that flow through this entity to support consumers in the individual market. See sections 26, 34, 172, and 173 for the transfer of the Patient Protection Commission to the authority. See section 355, which transfers the public option to the authority. And then the last division, the third one is the Division of Healthcare Purchasing and Compliance. This will oversee what we know today as the Healthcare Quality and Compliance Unit at DBPH, which is our licensing unit for facilities. It will also oversee the new Office of Medicaid Inspector General, Regulatory Counsel, Program Compliance, Provider Enrollment in Medicaid, and Credentialing. It also will include ensuring appropriate collaboration and coordination with the Commissioner Division of Insurance and their team. In the interest of time, I'm not going to read all the sections and statutes that apply to the transfer of HCQC from the Division of Public and Behavioral Health to the new authority, but most notably, they include healthcare licensure, investigations, medical laboratories, health and safety at healthcare facilities, and reporting of sentinel events. Also, the regulation of sanitation and food establishments and other certain locations. Additionally, the new authority will include a 4th entity alongside the other divisions, which is our Public Employee Benefits Program, PEB. See Section 68 through 74 that pertain to this transfer. Section 68 places the board under the new agency structure. The conceptual amendment that we have offered will remove the original changes to the board structure and terms, including the termination of all members appointed that are currently appointed and then be reappointed on July 1st, 2025 in Section 365. Also, our amendment brings forth a new section, 68.5, that would allow the board to elect the chair instead of the governor annually, and the governor then would elect the vice chair. Section 69 provides that the hiring and the appointment of the executive officer of PEB will be a shared process between the board and the director and the governor, with the board conducting interviews and making recommendations regarding the hire, with the director and governor being ultimately responsible for the final appointment to ensure accountability to the state, as this program has a major impact on the executive branch's ability to attract and retain state employees and to ensure that the coverage offered is affordable and sustainable for the state. Section 72 through 74 allowed the board to utilize purchasing services of this new authority. The conceptual amendment clarifies that the intent is to ensure that the board's role and functions will remain the same during the procurement process as it does today with this new authority. Section 72 also includes a new provision in this amendment that requires the board to take such measures as necessary to maximize benefits per participants and ensure high-quality customer service. See Section 1C of that Section 72 in the amendment. The bill also outlines other transfers to the authority, such as the Governor's Developmental Disabilities Council in Sections 26 and 34, and the Office of Data Analytics, as Director Richard Whitley referred to earlier in Sections 29. Other important items to note is that the bill references in Section 361 that projects funded by the legislature this session regarding workforce and healthcare should be moved to the authority. This includes the items in the Governor's Senate Bill 495, and the goal is that this would include the new Office of Mental Health, which is in the handout that we gave you of the org chart. There is a new section in the amendment, 362.5, that would transfer over regulation or food establishments if Senate Bill 466 does not pass, to transfer these activities from Division of Public and Behavioral Health to the Department of Agriculture. That bill is currently moving through the process. Additionally, the amendment includes language to ensure both agencies have access to background checks and data to ensure compliance with state and federal requirements. See sections 175.3 and 175.6 in the amendment. And with that, and hopefully I covered enough sections for all of you, with that we stand for questions. Thank you.
Thank you so much, and thank you for that robust presentation. Committee members, do we have any questions? Chair Brown-May.
Thank you, Chair Donyate. I appreciate that. As we start this, there are a number of questions, I think, here for members. It's my understanding that this is considered a budget implementation bill from our side. Can you talk a little bit about the work that has been done to fund some of these initiatives and where we are relative to that process?
Chair, committee member Stacy Weeks for the record. Yes, our budget was approved in full, and there were a few pieces added to it to support the new agency.
Thank you. Any other questions? Senator Titus.
Thank you. I've been dying to ask a question on this particular bill since I've been in the room. So, thank you. You did address my concerns about Section 86 right from the start on what that process was going to be like. So, thank you for that clarification. Just to increasing enrollment and who can do the enrollment. Is that my understanding now? Is that what that piece does?
Chair, committee member Stacy Weeks for the record, yes.
Right. And then the global picture of this bill, and I do appreciate you bringing it forward. I do think it is good. It's good business for the state of Nevada to do this. A clarification that was just brought up that this was already, we're not the finance committee, but a number of us sit on that committee. And we were looking at that this has already been built into the governor's budget that we have already looked at and gone through, correct?
Chair, committee member Stacy Weeks for the record, yes.
And the advantage of this particular bill is it's not only just access, but it's about efficiency of giving care to the patients by maybe peeling off some of these divisions to make sure that they can get the jobs done that they need to do.
Stacy Weeks for the record, yes, that is correct. The goal is efficiency as well as ensuring better transparency and more accessibility for the public.
Correct. Will it increase, do you see any increase in enrollment or actual true patient care by breaking these departments?
For the record, Richard Whitley, I think one of the efficiencies for growing capacity is the putting together of the payer and the regulator. I mean, anyone that works in healthcare might be familiar with the regulators. They do all the activities. They license new facilities, they routinely inspect, and they address complaints. In no particular order, other than when it comes in as a request. They also are funded for regulating healthcare facilities, funded half from CMS, which would be the largest payer with Medicaid, and then half from fee funding. As you know, a new provider in our state can't actually bill for Medicare and Medicaid until they're certified, and sometimes we're delayed in that. They have to be operating, and then if they're operating and we don't get out to get them licensed and to get them certified, they can't bill, and that's not an incentive for healthcare providers to come into our state. So I do see a benefit in capacity in integrating the payer and the regulator.
Thank you. I do feel strongly that this is all about government efficiency, because that then boils down to better citizen interaction and better patient care. So thank you for all the questions, Mr. Chair, and thank you for bringing it forward.
Thank you so much. We have a question from Senator Lang.
Thank you. So can you talk to me a little bit about how we can ensure both departments will work together? Because the issues are that we're still working in silos will still exist.
For the record, Richard Whitley, I mean, I we try to work with all agencies. I work with Department of Corrections because a lot of times people are incarcerated who have behavioral health backgrounds. I don't think anything will stop in that way. Additionally, Medicaid will be a payer for eligibility as they are now. I think the improvement is actually the synergy. I don't think we're losing anything in this in terms of working together. The data piece, which is close to me for incrementally growing the data analytics, is best placed with the payer. And so I send it off to the health authority, knowing that I'm going to benefit from the data that's collected on population health and health outcomes for the monitoring of the work that we're doing. So there still is integration. I think the fundamental challenge has been that direct service arm. We're one of a few states that still the state provides public health in the rural areas. We're one of a handful of states that operate a children's behavioral health hospital. We need to define, as Stacy grows the health capacity, and we know that people are insured, but we grow the healthcare system, we need to then define what role does the state play as the safety net. And that requires a focus. And so I don't think we'll lose anything, but only gain from that distinguishing of roles and clarifying conversations.
Thank you. Let's go to Senator Taylor.
Thank you, Chair. And if you'll indulge me, I do have a couple of questions. Thank you so much. And thank you for the presentation, and thank you for the innovative thinking around how we can better serve Nevadans in this really important area. So just a couple of questions. You mentioned, Director Whitley, that we're one of the few states that has a child behavior hospital. So fantastic. In terms of the way you're modeling this or the recommendation, do you see that in other states? How are other states dealing with as their health needs grow as well?
For the record, Richard Whitley, I think that other states, I think New Mexico comes to mind, are looking at this health authority concept, this purchasing power. The deeper dive with Washington State, who really, I think, was the first to do this, really was able to not only save money, but also add quality by working as a system approach. I think on that direct service side, most states are pivoting towards the forensic side of services on their civil hospitals. As capacity grows in the community, and as Stacy Weeks is able to increase rates and make it lucrative enough for the private sector to stand up psychiatric facilities and address the civil needs, the role the state needs to play is for the forensic side of doing evaluations timely for people that become involved in the criminal justice system, and hopefully intervene and keep them out of those systems. So that's the pivot we see nationally happening on the adult side. I think the same thing is true for the adolescent population. Maybe we're a little more robust on the adult side, sadly, but there are intervention points along the way. If you look at the data from child welfare to juvenile justice to the adult criminal justice system, there are multiple intervention points there that we should be providing. And the state, I believe, should be in the role to be that safety net while we're growing the provider capacity.
Fantastic. Thank you, Director. Just second question for me is, in looking at just the vast bill in this and the creation of the health authority, which again I applaud those efforts. You don't seem to talk a lot about the qualifications of the administrator. Now we know we're blessed to have Stacy Weeks. We know that, but one of these days she's going to retire. Hopefully not real soon, but yeah, we may not let her. But when it's that time, then of course, well, hopefully, I'm sure the work will be there. We'll want to continue it. Is there a place where you've outlined the educational qualifications for such a role?
For the record, Richard Whitley, I think not specifically in terms of credentials of the person. I mean, I think as we have filled positions across our clinical positions and expertise, I mean, I would say fiscal in our state agencies is probably one of the sparsest, lots of retirees, not a strong pipeline. So I think we have to look at all areas and aspects of government, IT, fiscal, HR, but then within the programs, the subject matter experts, certainly clinically, like we operate facilities that have to have a medical director. They're Joint Commission accredited, just like a private sector hospital. But the credentials of the person, in the past, we've brought legislation before this body to remove some of the strict qualifications for administrators in health and human services, and we're better because of it, because we were able to hire talent with the flexibility that maybe didn't have a specific type of degree or even I'll say a degree, but because they had worked for 20 years in state service and were able to effectuate change. So I think we can be adaptive if needed, but we certainly can put stricter requirements when we're recruiting.
I appreciate that. I wasn't asking for it to be in there. I wanted your thinking behind it, and I certainly follow what you're saying. And my final question, again, thank you, Chair, is with some of the impending changes federally in terms of Medicaid, do you anticipate that will impact this change that we're undertaking, or we would be at this time?
Chair, committee member Stacey Weeks for the record. No, right now, I mean, but I can never tell you what's going to happen at the federal level. I wish I could predict, but no, at this time, nothing that we're doing here would actually harm, or nothing at the federal level will harm what we're doing here is trying to restructure and get more efficiencies in our program. In fact, I think it will help us.
Thank you so much. Again, I applaud the thinking, and I'm excited about it. Thank you, Chair.
Thank you. Let's go to Chair Brown-May.
Thank you, Chair Donate. I have two questions. First, can you talk a little bit about how will the transfer programs like Medicaid and the Children's Health Insurance Program into the Nevada Health Authority have a direct effect on our current beneficiaries? What will they experience?
Chair, committee member Stacey Weeks for the record. Are you talking about the Children's Health Insurance Program?
Thank you.
Children's Behavioral Health, sorry.
Thank you. No, all of it. As we transfer programs and we separate the service delivery model into the new Nevada Health Authority, as we bifurcate the system now, what will our beneficiaries experience? If I'm the person that's receiving service, how am I going to see that the Nevada Health Authority has been implemented, or am I going to know that at all?
For the record, Richard Whitley, I don't think as a consumer that you would see a difference. I think we already, on the service side, bill Medicaid. We already have agreements with Medicaid as a service provider. I think that it clarifies the role, but I don't think the consumer. I mean, even on the public employee benefit side, we do a study every year because of statute on the top employers who have employees enrolled in Medicaid, and the state ranks in the top 10. My agency has the highest number. When raises were given, some people no longer were eligible for Medicaid or checkup, and then moved into the public employee benefit program. We held town hall meetings with those employees, and some of folks actually said they felt like their Medicaid benefit was better. So I think that tying the systems together on the other side will have a benefit for recipients. There is a churning group of people who maybe get a promotion in the community and they no longer are eligible for Medicaid. And those are the people we could help lift and I think support to move out of poverty. But we've experienced it with our own state employees when we have done town halls with employees who were changing their benefits.
Thank you for that. Thank you. It's good to know that our people who are on service receiving those benefits now won't feel that as we make this administrative change. That's really where I was heading with that. So thank you for that clarification. My second question is really with regard to the Inspector General position within the Nevada Health Authority. How will that position help to enhance oversight and prevent that fraud, waste, and abuse that we always talk about?
Chair, Committee Member Stacy Weeks for the record. So right now, this unit is under the Medicaid program and is tied with the Medicaid programs. As you look nationally, more and more states have their fraud, waste, and abuse, their what we call SIR, Surveillance Utilization Review Team, as well as our auditing team. Most states have that separate from the program to ensure independence. And so by pulling this out, recognizing this unit, which does really important work, which is often not the topic, except for this session, and nationally it has become more of the topic, but it's really important work that we need to ensure is independent and is really supported, I think, by an attorney. I think that's one of the really important things that's in our budget that was approved, is having that legal expertise to support that team. But the person overseeing that's a reclass of their position to really elevate and recognize that work in the agency, but also bringing it over outside of the program.
Thank you. And then just one final question. The positions that you have identified on the organizational chart, those have all been included in your budget closings, and we have those funded and are part of the organization chart with our budget closing. Is that correct?
Chair, committee members, Stacy Weeks, the record. I'm looking at it. Yes, the only one which has the asterisk there is the Office of Mental Health. Depending on where all of that lands, those pieces were not in the budget, but obviously we will support whatever passes in that other bill. Thank you.
Thank you. Thank you, Chair.
Thank you. Any other questions or comments? I just had one. Obviously, we've had extensive discussions about the bill and the amendment that was posted online. I had a question specifically on page 89, specifically section 86. Mentions that the authority may delegate to another state or local governmental agency the responsibility of making determinations and so forth. I wonder if you would be interested in, I know we've had discussions about doing it with tribes, and so maybe if I can give you, if the committee allowed to give you explicit language or permission to do so, I don't know if that would be something that you would be open to.
Chair, committee member Stacy Weeks for the record. Yes, would be more than willing to add something like that. Some permissive language would be fine and helpful. Thank you.
Great, thank you. I think that concludes my questions. We'll obviously have more discussion offline, but I don't know if there's any other last minute ones. Seeing none, let's go ahead and open it up to testimony and support. If you are here to testify in support, we ask for folks to please come forward. Again, a great ditto would be great as we're going through this. Let's start here in Carson City. Again, the 30-30-30 time length applies. Let's hope we don't have to use all of it. Please proceed.
Thank you. Good afternoon, Chair Donate, Chair Brown-May, and members of the Joint Committee. My name is Jacqueline Nguyen, Nguyen, and I'm representing the Nevada State Medical Association. On behalf of NSMA, I want to express our strong support for our Senate Bill 494 and the proposed creation of the Nevada Health Authority. As Nevada's population continues to grow, so too does the demand for accessible, high-quality health care. Yet our agencies are consistently being asked to do more with fewer resources. SB 494 represents an innovative and strategic response, one that allows Nevada to maximize existing resources and strengthen the coordination and delivery of our systems. We believe this restructuring will enhance the state's purchasing power, helping to secure better value for taxpayers, improve insurance offerings, and streamline coordinate services. Thank you so much, and we're in support.
Chair Brown-May, Chair Donate, and members of the committee, thank you for the opportunity to speak today. My name is Amy Hines-Sutherland, HYNE-SUTHERLAND, Health and Human Services Manager for the Nevada Association of Counties, or NACO. NACO supports Senate Bill 494. We want to thank the leadership of the Division of Healthcare Financing and Policy for working with us on some provisions of the bill that directly impact counties. Counties are often the frontline implementers of state health policy. As such, we welcome the newly proposed structure and the positive impacts we anticipate for local governments and the communities they serve. The consolidation of aligned programs will increase efficiency and enhance the state's ability to implement initiatives effectively and equitably across Nevada's communities, including rural and frontier counties where resources and capacity are often limited. Counties look forward to working together with the new Nevada Health Authority, and we urge the legislature to support this innovative reform. Thank you.
My name is Dan Musgrove with Strategies 360 today, representing a number of my clients, both for-profit and nonprofit, whether it's Behavioral Health Solutions, the Valley Health System, Revive Healthcare Services for on the for-profit side, West Care, Nathan Allison Hospice, Miracle Minds Therapy on the nonprofit. I think your questions and some of your comments hit the nail on the head. Time is money, whether you're a for-profit or nonprofit, and efficiencies matter. And it makes it better to do business in Nevada when we have a streamlined process that works through those silos that we all talk about. And so just for that point alone, we're very supportive of the bill. Thank you.
Good afternoon. My name's Patrick Kelly with the Nevada Hospital Association. During the 1990s, I was part of a group tasked with trying to divide a Health and Human Services entity in another state and restructuring it. And I can't tell you how difficult that is because all the programs intertwine. And I am very impressed by this plan of taking the purchasing of healthcare data and quality and placing it in one organization. I think that's a successful plan. But in addition to having a successful plan, you have to have the people who can execute the plan. And I think we're at a very unique point in Nevada's history of having those people. I'm always so impressed with Nevada Medicaid and all the other leaders in DHHS that I think this is really the opportunity to make a big difference, and I urge you to support the bill. Thank you.
Good afternoon, Chair Doñate, Chair Brown-May, members of the Joint Committee. My name is Chris Fatone. I'm here with Nevada System of Higher Education in support of SB 494. We particularly support the creation of the Nevada Health Authority, and we also want to highlight the graduate medical education provisions of this legislation, coupled with provisions, proposed GME expansion and other legislation, and reaffirm our commitment to working collaboratively with the state and GME stakeholders to expand GME programs that meet Nevada's growing healthcare needs. And she looks forward to continuing to partner with the state to support initiatives that enhance the accessibility, affordability, and quality of care for Nevadans. Thank you.
Good afternoon, Chair Doñate and Chair Brown-May and members of the committee. Sheila Bray with the University of Nevada, Reno. We too are in full support, specifically as it points out the GME change to the Nevada Health Authority and all of that to keep it moving. So thank you.
Good afternoon, Chair Doñate, Chair Brown-May, Tess Opferman for the record here on behalf of the AFSCME retirees. I will speak specifically to the portion of the bill relating to PEB. I will just say this is no critique of PEB or employees at PEB, but it is a system that is not working for our state employees or our state retirees. We see this bill as a huge opportunity to combine resources, serve our participants better, have better access to customer service. So with that, we're in full support. I do want to say a special thanks to Stacy Weeks for working closely with our Public Employee Coalition. We did work on an amendment with her. I will say we have suggested one additional amendment to this committee, so that is submitted. I don't need to go in depth into those changes, but we do have some additional changes to the board specifically. It says that the state labor organization, the largest labor organization, submits a list of 10 people. We would like that to revise that to 3 people. And then a few other changes. We would like PEB to produce a report that talks about the costs faced by Medicare retirees. So we've submitted that amendment. We have clarified that that is as funds and information is available. We certainly do not want to add a fiscal note to this bill. So with that, I will just say we're in support of the bill as is, but we also would like you to consider our amendment. Thank you.
Good afternoon, Chair and members of the committee. My name is Cassie Charles on behalf of the American Federation of State, County, and Municipal Employees. I would like to echo the remarks of my colleague from AFSCME Retirees as we are working together with Stacy Weeks on proposed amendments. But similarly, we are here in support of AB 494 or SB 494 as is currently proposed. State employees have been in need of a change regarding their health plan and services for the last several years. We see SB 494 as a good faith effort to create positive change within the Public Employees Benefits Program, and we look forward to working with this body and Nevada Health Authority on proposed amendments to further improve the systems that AFSCME members rely on. Thank you.
Good afternoon, Chairs. For the record, Leonardo Benavides with UNLV. I also want to echo the sentiments from my colleagues from NSHE and UNR, particularly when it comes to GME. We're supportive of the efforts undertaken on SB 494 as well as SB 262. Thank you.
Chair, members of the committee, my name is Helen Foley, and today I am representing First Med, Federally Qualified Health Center, and I am chairman of the board of First Med. It's a gold standard FQHC, which means they're in the top 10% in the nation. And one of the reasons that they've been so successful here is because of Stacy Weeks and Richard Whitley. And we believe that this is an excellent piece of legislation and strongly support it. Thank you.
Good afternoon, Chair Doñate, Chair Brown-May, and members of the committee. Allison Herzik, Director of Nevada Government Relations for Dignity Health St. Rose Dominican. We are in strong support of Senate Bill 494. We believe this proposal modernizes our state's healthcare system and helps move healthcare delivery in the right direction. So we thank you for hearing this bill, and we urge its passage. Thank you.
Thank you, Chair and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, here in full support. Thank you.
Good afternoon, Chair Brown-May and Chair Doñate. Joelle Gutman-Dodson, representing Northern Nevada Public Health. And I just wanted to talk about this from a public health perspective. I wasn't going to come up here, but we really appreciate Director Whitley's comments about the need to look at the service delivery models in Nevada. There's room for us to grow, and this is a very promising step in the right direction for Nevada as a whole. Public health in Nevada has also looked at Washington State as a model for foundational public health services, and we wanted to thank the Governor's Office, Director Whitley, and Stacy Weeks for bringing this bill. Thank you.
Good afternoon. My name is Chris Bosse, BOSSE, Chief Government Relations Officer for Renown Health. We echo many of the comments of support made, and we encourage your support.
Thank you. Anyone else here in Carson City? Let's go to Las Vegas, please.
Good afternoon, Chair Doñate, Chair Brown-May, and esteemed members of the committee. My name is Dr. Rupesh Parikh, RUPESH, PARIKH, and President of Comprehensive Cancer Centers of Nevada. I want to strongly also express the support of SB 494, which proposes the creation of this health care authority and the restructuring of our state's health and human services, which represents a critical steps towards improving healthcare delivery for all of Nevada. With many complexities and challenges facing healthcare in Nevada, this bill offers a promising solution by consolidating healthcare functions under one roof. I believe this approach will help streamline coordination, help administrative burdens, and improve the continuity of care. It will also enhance data sharing and oversight, and allowing more effective population health management and evidence-based decision-making. By centralizing planning and resource allocation, the bill has the potential to expand access to services, especially in our underserved communities. In my daily practice, I see this every day. I see the systemic inefficiencies that patients and my staff have to take on along with their families. I hope that SB 494 presents a transformative opportunity to build a more responsive, equitable, and sustainable healthcare system in our state. I support this legislation, and I encourage all of you to support it as well. Thank you.
Good afternoon, Chair Doñate, Chair Brown-May, and members of the Joint Committee. My name is Todd Sklamberg, and I have the privilege of being CEO at Sunrise Hospital and Sunrise Children's Hospital for over 13 years. I'm here today to voice my strong support for Senate Bill 494. I want to start by thanking Governor Lombardo for his leadership in working to improve health care for all Nevadans. I also want to thank Director Whitley and Administrator Weeks, as well as the numerous dedicated staff employees who work on their teams who administer essential healthcare programs throughout the state. While it often goes unseen, the proper function of government is incredibly important. This is particularly true when it comes to the administration of Nevada's healthcare system. Healthcare plays a critical role in the vitality of our state. A well-functioning healthcare system leads to a healthier workforce, increased productivity, and reduced healthcare costs, ultimately boosting economic growth and stability. The state has and should continue to invest in healthcare. Medicaid alone represents a significant investment in state resources. Today, 1 in 4 Nevadans are covered by Medicaid. Medicaid makes up more than 30% of the state budget. Putting Medicaid and other important healthcare programs under one agency, Nevada will be better able to streamline complementary programs ensure efficient management of state programs to improve access, like GME, and position itself to compete for federal funding. By passing Senate Bill 494 and establishing Nevada Health Authority, you'll be making an important investment in Nevada's healthcare infrastructure and the long-term sustainability of our health system. I strongly urge you to support this bill.
Chair Senator Donate and Assemblymember Browns May and members of the Joint Committee. My name is Renee Ashoff, and I'm the Assistant Vice President for Administration for Touro University, Nevada. We speak today in strong support of Senate Bill 494. The bill's creation of a centralized authority with a mission to promote healthcare access, affordability, and innovation aligns with our mission at Touro University and offers new opportunities for collaboration, particularly in areas like Medicaid, primary care expansion, and health equity. We appreciate the legislature's commitment to building a healthier future, and we urge your support for this bill. Thank you.
Thank you so much. Anyone else in Las Vegas? AVH, is there anyone online?
Testify in support on SB 494, please press star 9 on your phone to take your place in the queue.
Good afternoon, Chairs Donate and Brown May and Joint Committee members. My name for the record is Terry Laird. I'm the Executive Director of RPEN, the Retired Public Employees of Nevada, an organization nearing its 50th year of existence. RPEN currently has 7,000 members statewide, and many of our members are served by the Public Employees Benefits Program, PEB, the state's health plan for actives and retirees. The Nevada Health Authority, if passed in its original form, would have changed PEB dramatically. The state's health plan does have a stormy past, and many years ago, RPEN and other public employee groups were able to put in place a board to have oversight of the agency to prevent such issues from reoccurring. However, concerns that we had with SB 494 have been addressed by amendments you heard about from Ms. Weeks in her presentation, along with previous public comments from speakers in our Public Employee Coalition relating to PEB and the PEB board. We do appreciate the consideration given to our concerns, and I'd also like to ditto remarks made by previous speakers, and we too urge your support. Thank you.
There are no more callers in support at this time.
Thank you so much. Let's move on to opposition. Is there anyone in opposition to this bill? I don't see anyone here or in Las Vegas. AVH, is there anyone online?
If you'd like to testify in opposition, please press star 9 on your phone to take your place in the queue. There are no callers in opposition at this time.
Thank you. And last but not least, is there anyone in neutral on this bill? Please come forward. Go ahead and proceed.
Thank you, Chair Donate, Chair Brown May, Brett Scolari, Strategies 360, here on behalf of the Reno Sparks Indian Colony. I'm here in neutral today just to propose a friendly amendment to reconcile Section 348 of SB 494 with SB 97 that passed both houses unanimously and is with the governor for signature now. SB 97 provides that a Native American from a Nevada tribe be appointed to the Silver State Health Insurance Exchange Board, and that member would have experience in tribal healthcare administration. So this amendment that I uploaded to Nellis proposes the same change in Section 348. Thank you.
Thank you so much. Please begin.
Kent Irvin, ERVIN, Nevada Faculty Alliance. Good afternoon. SB 494 moves the Public Employees Benefits Program inside the Nevada Health Authority. PEB in its current form was created in 1999 as an independent agency with a fiduciary board to protect state employee benefits after financial scandal required the legislature to bail it out. We greatly appreciate that Administrator Weeks worked with public employee advocates to bolster the PEB board in the DHH amendment compared with the bill as it was introduced. The NHA promises to provide resources and expertise to help PEB achieve its mission and better serves participants. The Nevada Faculty Alliance is neutral because we can and will work with NHA and to make PEB better if the bill passes with this amendment. However, we have submitted additional amendments for the committee's consideration that would enhance PEB and the PEB's board's ability to serve in its fiduciary capacity for participants, the program, and the state. That include changes to board appointments and making sure that the board has full oversight over contracting. Thank you for considering that amendment. And also, given the testimony of Director Whitley, perhaps, to back up, a lot of our constituents, when they first heard about this proposal, feared that PEB would become Medicaid. That's clearly what's not going on. But given Director Whitley's testimony earlier, perhaps we need to bring PEB up to the standards of Medicaid. Thank you.
Thank you so much. Any other comments? Oh, I see someone in Las Vegas. Go ahead.
Thank you. Doug Unger, D-O-U-G, U-N-G-E-R, UNLV Chapter President, Nevada Faculty Alliance, and member UNLV Employee Benefits Advisory Committee. I've been attending PEB board meetings and acting as a UNLV employee advocate to PEB and its insurance plan administrators for 14 years. Over those years, I've come to appreciate the statutory independence of the PEB board to steward state employee health care and other benefits. We are grateful to Administrator Weeks and the governor's staff who are setting up the new Nevada Health Authority that they have been willing to work on amendments to the original text of SB 494 that maintains some of the PEB board's independence and authority, although also its board member selection process and continuity. We would like to see clearer language assuring the PEB board's power to approve or disapprove contracts. I have a long memory as a state employee, and I can recall the 1997 to 99 catastrophic failure of the health insurance administrator for state workers that left our bills unpaid and bankrupted the system. That was the last time state employee health care was managed by one centralized executive authority, which was one of the reasons PEB was created in the first place. Still, we can see the potential of new Nevada Health Authority to reform and improve health care administration for the whole state, which is much needed. The noble aspirations and cooperative spirit to work together with stakeholders move us from opposed to neutral on SB 494, hoping for the best. Thank you.
Thank you. Anyone else in neutral? AVH, is there anyone online?
Testify in neutral, please press *9 on your phone to take your place in the queue. Caller with the last 3 digits, 763, please press *6 to unmute yourself.
Hello, my name is Heidi Sterner, H-E-I-D-I-S-T-E-R-N-E-R. I am a licensed health insurance professional in Nevada for nearly 30 years, and I currently sit on the Division of Insurance's Agent Advisory Council and Network Advisory Board for my first term and the Agent Advisory Council for the third term. While I am generally in support of SB 494 and agree with creating the economies of scale for the Nevada agencies impacted, I am testifying in neutral today as I have concerns with Section 348 and the reorganization of the Silver State Exchange Board of Directors. While I am not opposed to the administrator of Medicaid, the director of DHS, and the commissioner of insurance serving as voting members and have previously supported SB 97 to allow for the appointment of a representative from the Indian tribes by the governor, I would encourage expanding the board to include these administrative officials as additional voting members rather than replacing existing ones. Many current board members have experience working directly with consumers, assisting them with enrollment and navigating coverage options, Replacing these positions with high-level administrators may risk diluting the board's ability to address frontline consumer issues, as it would reduce the number of members with direct engagement and insight into the day-to-day challenges faced by those seeking coverage. We appreciate the knowledge and efforts of Stacey Weeks and all others involved in developing this bill. Thank you.
Chair, there are no more callers in neutral at this time.
Thank you so much. Do our presenters have any closing remarks? Seeing none, I'm going to go ahead and close this hearing, and we will move on to our last agenda item, which is public comment. Is there anyone that would like to provide public comment at this time? Seeing none here or in Las Vegas, AVH, is there anyone online?
Participate in public comment, please press star 9 on your phone to take your place in the queue.
Hello, committee members and Chair Doñate. For the record, my name is Antonio Ventura, Ventura, with the Nevada Dental Hygienists Association. I just want to thank you guys all for the hard work you do that affects Nevadans, our families. I've been part of the legislative process for a couple of years, and I still get nervous, so I don't know how you guys keep all this and not get nervous. Thanks for listening to all the public health concerns and safety concerns expressed by our colleagues. I do want to put it on the record that we were not approached by any other entities or organizations about our conversations regarding this bill. So no conversations have had between the Dental Hygienist Association or the Dentist Association. So I just want to make sure that was on the record. Thank you, and have a good day.
Chair, the public line is open and working. However, there are no more callers at this time.
Thank you so much. And of course, thank you to our staff and all the folks who helped with the joint hearing today. Before we conclude, I do want to make just a quick few remarks. We do have a scheduled meeting of the Senate Committee on Health and Human Services in this room. We are going to need a couple minutes before so that AVH can transition. And so the senators will stay behind for our meeting, and we will probably begin in the next 10 minutes. So folks have time to use the restroom and so forth. With that, we will conclude, and thank you all for joining.